Good morning and welcome to the second edition of Gratitude Week, a tribute to our health guardians. I am Kamal Narayan, CEO of the Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy and behavior change. The Gratitude Week holds special significance for us. It is India's longest marathon Thanksgiving program that we institutionalized last year as a mark of honor for the brave doctors, nurses, and all other health workers who continue to lead the fight against COVID-19 from the front. We began this observance on National Doctors' Day to showcase the selfless service of our doctors and other frontline workers who left all comfort and threw themselves in the uncertainty of a pandemic for the sake of others. No words can be enough to thank them for laying down their lives in service of people, and the Gratitude Week is our humble effort to draw together the grateful voices for them. The journey this year was kick-started by none other than the Union Health Minister, Dr. Harshvardhan. Since then, in the last 4 days, we have been joined by a galaxy of luminaries, including family doctors, specialists, medical educationists, hospital administrators, members of the industry bodies, lawyers and social activists, and humanitarian workers who not only highlight the life-saving contribution of the healthcare workers, but also to discuss some of the most pressing issues related to their work and the challenges before our public health system. And we are concluding each day with a rich musical tribute to all health heroes through live performance by artists and troops of school children. Before we move ahead, let's rewind the journey so far.
History shall bear witness that when the time came and humanity needed to be saved, it was the doctors who stepped up to answer the call of duty.
डब्ल्यू के द्वारा जो ये आपने डॉक्टर्स डे पर चिकित्सा दिवस पर इस कार्यक्रम का आयोजन किया है, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ.
Congratulating the Integrated Health and Wellbeing Council for this unique gesture to honor the doctors and other people in the medical community who are the most dependable resources to fight this pandemic.
7 दिनों में भाग लिया है, तो सभी का मैं धन्यवाद करता हूँ. डे के अवसर पर दुनिया के सभी डॉक्टर को, भारत के सभी डॉक्टर को मैं शुभकामना देता हूँ, हार्दिक बधाई देता हूँ. जय भीम, जय भारत.
I would really say the doctors have actually risen to this challenge in this unprecedented times, and that is something which is very heartening, not only in our country but at a global level.
We got to get together to support a true legislation and a strict legislation of against assault to doctors.
We need to be really serious about and have a rethink about the final delivery system we need to adopt about the delivery of healthcare. Should it be state versus the central?
By communication, having compassion, having empathy, feel the pain of the other person.
Having said that, have 3 attributes: sympathy, empathy, and compassion.
There is a lack of empathy. Probably that is one thing I can agree with that, but there are other issues that many a times the doctor is helpless.
Younger population is definitely, active. That is why they are more, exposed to infection, and we cannot say that they are less or they are going to be in future.
So definitely there has been an improvement in the number of stroke patients coming to the hospital, but it has not still reached the pre-COVID level numbers.
What COVID did to especially India, one, it disrupted the NCD services totally. The second most important thing it has caused.
We need to talk to actual people in the Center for Disease Control, the virologists, people like you who are on ground. We need to understand and fight this scientifically.
Yes, the fear is still there, but as I said that the passion is to sure one day that India is a developed nation.
खूब लगा लो पहरे रास्ते रब खोले
तू न जाने आस पास है खुदा
So on our fifth day today, we are addressing a vital health concern of the day, misinformation. The term refers to false or inaccurate information that is deliberately spread and pushes people away from the correct one. The problem may have its roots on the internet and its rapid popularity across the world, but misinformation has tightened its grasp on humanity with social media. The magnitude of the problem has increased so much that doctors have pointed at it as a serious impediment to delivering treatment and even to their work environment. The infodemic, as it is known today, can severely compromise the nation's fight against such crises. Ever since the pandemic broke out, we have seen how a series of systematic misinformation campaigns have misled people and affected life and livelihood, and it has even threatened to jeopardize the safety of our health workers. Be it people shunning poultry and eggs, fearing they will contract COVID-19, causing huge loss to the industry, people popping up anything and everything as so-called immunity boosters, or to more shocking instances of young doctors and nurses being thrown out of their accommodations. The origin of all these can be tracked to misinformation being so easily circulated on internet or WhatsApp. Misinformation has been identified as one of the most prominent reasons why even educated Indians are hesitant to get vaccinated against COVID-19. A step that can not only make them very sick, but even can prove fatal. How does it feel to live in a pandemic amid the barrage of misinformation? And can we get over its effect to ensure safety access to or safe access to modern medicine for all? To answer these questions, and we have an esteemed panel of health communication experts at the inaugural session today. So let me start by introducing Ms. Archana Vyas, the Deputy Director for Communications at the India Country Office of Bill and Melinda Gates Foundation. Ms. Vyas leads the brand strategy, program advocacy, communications, social and behavior change communication, and media relations. A veteran in communications, Ms. Vyas, during her quarter-century experience, has been driving critical and impact-making communication in campaigns for a wide variety of brands, institutions, and issues. Ms. Vyas has also served on World Health Organization's Technical Advisory Group on Behavioral Insights. She has been recognized by several institutions, including International Advertising Association, for her stellar and innovative communication work. So welcome, Ms. Archana Vyas, on this panel today, on the fifth day of Gratitude Week. We have with us Nikki Gupta, co-founder and CEO of Teamwork Communication Group, a health-focused communication agency. Nikki is an entrepreneur and a passionate PR professional. She is a founding partner of Teamwork. She is an ardent health communicator and publicist and has led several impactful campaigns on health and disease awareness. She has been recognized among the top 100 influential game changers in the area of PR and media. So welcome, Nikki, on this esteemed panel today. We also have Dr. Jyotsna Sistla, Assistant Manager, Banega Swaksh India at Reckitt. With a background in public health, she works with the partners and internal stakeholders to ensure that Reckitt's purpose-led programs are supported to achieve their intended impact. She is actively involved in arranging donation and the fight for access fund for COVID, has worked to develop an STI risk assessment app for LGBTQ community, and is involved in bringing the Durex supported birds and bees talk to a completely digital format to make it reach a larger community. So welcome all our three panelists. We have not been able to get participation of a couple of our other panelists who were supposed to join us today, Bonnie, but since maybe some emergency engagements, they have not been able to join. So let's begin our discussion. And I'm also it's interesting coincidence that we have an all women panel, and communication can be considered more compassionate and more empathetic when it is being done by women. So I think that's going to be a wonderful opportunity to understand how to make communication more sympathetic, as even being highlighted by some of the doctors which you saw in the video. So let me begin with Ms. Archana, with you. Archana, how do you see this infodemic as a challenge? As health communicator, do you find it kind of obstructing delivery of communication or the delivery of accurate message which you want to deliver to the people?
So thanks a lot, Kamal, for inviting me to this panel today. It is absolutely momentous that you are celebrating gratitude towards doctors. So on behalf of Bill and Melinda Gates Foundation, first of all, I would like to offer our gratitude to the great work that the health workers have done. As you stated, infodemic or mis or disinformation, as you've spoken about earlier, it is a health crisis when it comes to COVID. Because when you're expecting people to have accurate information, when so many people are suffering from the pandemic, it is really important that they have accurate information at hand to be able to take right kind of decisions. And I think miscreants, anti-vaxxers, and also other communities, perhaps even those who do not have the accurate information. So you can't actually say that all of them have bad intent when infodemic is spread. Some people are naive, some people are gullible, some people trust information that is actually shared by friends, families, because, if you look at WhatsApp messages, it is a source of information as well, right? I mean, it's nowadays people tend to follow and get news from WhatsApp rather than actually looking at newspapers or television channels. So some people are doing it not necessarily with harm and really in their mind, but the fact is that infodemic or misinformation is harming a lot of people, right? When you want people to have, as I say, accurate information, get information that is science oriented, so that they can take the right decisions to save their own lives and lives of their loved ones. Misinformation actually does disservice. There has been a lot of study that's available that there are millions and millions of websites that actually went live with inaccurate information straight when the pandemic started, right? So it is at the same time, there are various strategies, right? I mean, you need to know what trusted sources are. People are looking for right kind of information. So it is duty of various actors and various stakeholders to make sure that the accurate information is readily available to people who are looking for them. Thanks.
Thank you so much, Archana. One follow-up question. When you see that, and you are, kind of also highlighting that there has been a kind of a barrage, and as you see that, millions of websites you are saying that which, kind of mushroomed with a lot of non-scientific, inaccurate information as well. When it comes to crisis like, pandemic, where it is very, very important to make people behave in a certain way, and largely in a uniform manner, because then only you can drive a certain kind of public health outcome. Otherwise, it is going to be very difficult. What has been your experience in that sense? For example, Bill and Melinda Gates Foundation has been working in many disease areas where you need to drive a certain, maybe AIDS is one of the area. So do you see that when there is so much of misinformation, that it becomes really difficult for people to get into that where is the right information and where it is not?
So we've actually been working very closely at the foundation with the Ministry of Health. So a few things that I would say. One is that one needs to assess the quantum of misinformation, right? And that we are doing very closely with Ministry of Health, because the Ministry of Health has instituted a war room that looks at traditional media as well as digital information on a real-time basis. So we are supporting, UNICEF is supporting, and we are supporting in terms of that effort. So the war room, actually, there are, today with digital technology, it is very much possible to track all the information, all the conversations that are happening digitally, right? So you can assess the quantum. And then you also assess in terms of what are the sources of information. So there are studies and research that's available that points out that governments, and it is not exclusive to India, but definitely for India as well, that government of India or Ministry of Health is a trusted source of information, and so is WHO. Right, so it is important. Therefore, the onus therefore goes on the Ministry of Health and WHO and other trusted sources to give out the right kind of information. And the ministry has taken a very, very solid stance on this one right from the start of the pandemic. They have made concerted effort so that, one, their website is refreshed. It has all the kind of information that's available accurately. So if there was traffic before pandemic, which was around 0.5 million people who were visiting the ministry website, today more than 8 million people actually visit ministry website. They have a helpline in place. There is a chatbot that's been put out by MyGov. At the same time, press briefings are being taken every day. So every day there is active listening. And therefore, the channels are informed by science. They are informed by experts. The knowledge dissemination is informed by science and accuracy, right? So, to the extent that the real-time tracking tells you that if there is, a lot of search that is going up around black fungus, it feeds into the narrative or the accurate information that the ministry would like to provide through its press briefing or use of experts. They will augment, saying if people want to know more about black fungus, that kind of information is being provided.
Is this the real-time tracking happening by the Ministry of Health, where what are the people searching on Google or
absolutely
and they are taking that into the consideration?
Absolutely. So there is immense effort that is being taken by the Ministry of Health. So therefore, expert voices, accuracy of information is really important. But at the same time, there are partners who have come forward. Google, Facebook, Twitter, if you look at them, right, because they are like large sources of information, right? So Google is actually prioritizing Ministry of Health and WHO as a source for information. There are specific innovative products that have been created so that when you type in COVID, when you type in side effects, when you type in other words that are related to pandemic, right, and people are trying to get that information, then the search results are through their backend. They are optimized in a way that the accurate information comes out first, right? So Twitter has a special dedicated channel that focuses on COVID. So does Facebook. And these are all partnerships with the government of India where accurate information is being provided. So the channel platforms have come forward as well. And the third thing that I would say that from our learning of we work again a lot with the government of India, not here, but also with other governments on vaccination programs. So vaccine hesitancy is a phenomena which is not exclusive to pandemic, right? Even the other vaccine complements that have been rolled out in the country, there are people who are hesitant towards taking vaccine because, you're injecting something. Then there are also other, not necessarily fact-driven myths or fears that perpetuate in people, right? Because I'm putting something in my body, it may harm me, I can die, there's not enough research behind a vaccine. So there are so many myths, but there are ways of dispelling that as well. And I would just talk about one strategy that, there are other strategies as well. Just one of the strategies that we've worked with, especially in states of UP and Bihar with vulnerable populations who get affected by, these fears and these myths, is use of influencers, because people tend to believe people who are close to them, right? It is the same phenomena that you see on Facebook, that I would tend to believe my friends and family, right? And likewise, people do believe other people who are close to them. So local influencers, local, religious leaders, teachers, other influencers like panchayat leaders, those voices are really influential in villages, and therefore, they have been effectively used for the polio program. They have been effectively used for the other vaccine programs. These are voices that we're using again in the states of UP and Bihar. Some tried, tested strategies that work, especially with people who are hard to reach, are being deployed for this pandemic as well.
Thank you so much, Archana. Very important aspects you have identified, and also, kind of highlighted how, the immense efforts are being put by the governments, and not only governments, also these, the important or the most critical source of information in today's world, and which are your, search engines like Google or Facebook or, all these social platforms. And they too are, kind of trying to make sure that the accurate information, the scientific information, or the authentic information is given priority in terms of when it reaches to the people. Yeah, important point about the use of influencer. Nikki Gupta was smiling on that. That's also an important aspect, and I'm sure that also has other flip side as well. So let me first go to Nikki, and Nikki, we will come to the influencer part of it, as you seems to be interested on it. But let me ask a question that Seema, Ms. Archana is saying that there are a lot of sources of information which are authentic, which to be believed, and which are there, and they are putting all information. What happens many times when the normal people do not or are not able to differentiate between the information which is completely authentic, reliable, or sometimes the information which may be kind of intended to give them false message. And in today's internet world, many times things even come in this deep fake kind of scenario. Anything can be said as a, let's say WHO reported, or WHO saying, or something like this. Do you see, where do you see the, source of, these misinformation? The sources are brands also sometimes pushing some kind of, unscientific, or let's say not that accurate information, maybe making claims which can lead to a certain kind of behavioral, change in the people. For example, brands have been, talking a lot about immunity booster, something like this. Now, boosting immunity can also give a false impression to the people that, okay, I have popped so many pills and I'm largely protected now, so I may be a little more, let's say, relax in terms of, or put off my mask more often. So do you see that brands also, or organizations also, sometimes fuel this or something called infodemic?
Right, Kamal. Thank you for having me today. So Archana quite covered a lot, good insight. So I feel infodemic is a equally a dangerous virus as virus. Is a dangerous as virus. It's not. We are not only fighting with COVID. At the same time, we are fighting against misinformation. Be it government, as she was talking about, that government is having a war room, right? Be it brands are also equally, I would say, I'm not talking about some specific brand. The responsible brands are contributing to give the right message to the audience, or be the communicator like me, Archana, and the other panelists, right? So we also try to give the right information to the audience so that they are aware. So it is certainly it's become a challenging situation, especially for the healthcare industry, as India is facing a healthcare crisis. But at the same time, it's difficult to differentiate between misinformation and disinformation for the ordinary person, be it a fact versus fake. I'll just give you one example. As you mentioned about, two things that you talked about. One is the mushrooming of the healthcare brands like immunity booster. Everybody wants to sell immunity booster. Be a big brand like Patanjali, who, which mentioned about in a press conference that it is a WHO approved, where the later on they shared a disclaimer and they shared a statement in the media and they talked about it is neither, Coronel is neither WHO certified nor approved. So these are the brands who are at the same time, some brands who are giving not correct information, misleading information, but there are certain brands who are playing vital role to give the right information to the audience. I would love to mention about Lifebuoy. Lifebuoy did a series of, advertisement where they talked about wash your hands, no matter which soap that you are using. It's very important to wash your hands. And they did the phenomenal part with Lifebuoy. They did the series of advertisement, 4-5 phases of advertisement where they talked about pre, post, ongoing, how we are going to protect ourselves. So that was a phenomenal. Another, I would like to give example about Uber. Uber did an amazing job globally to talk about people to stay at home, don't travel, which is against, it is actually impacting their business. But what they are advocating, do not travel, stay at home. So that was I would say some brands are very conscious, very responsible. They are very showing empathy, very sympathy with the whole movement and communicating with the audience, common man, telling them right informations. And there are some brands who are just trying to sell something in the media, no matter whatever they are saying. So a piece of misinformation can spread like a wildfire. Brands like Patanjali should not use this kind of statement, which can lead to a lot of issues. So yes, these are some of the highlights which I feel,
Thank you so much, Vicky.
Brands need to be very trustworthy and they show their empathy.
Important point you are highlighting, and that is one. This also shows that when it comes to public crisis or crisis of this sort, brands, organization, and everyone has a certain responsibility, and this responsibility goes beyond your business interests, and that is what I think you are highlighting when you are mentioning the example of Lifebuoy or Uber, which they are trying to kind of make a communication which is not a typical advertising in that sense. Though it can also be considered in a different kind of marketing, but that to kind of strike a chord with the audience.
So having said, I agree with you. For brand perspective, it is important to do the marketing, but at the same time, you are sharing a right message with the common man.
Yeah, so that's a bigger takeaway from this. Dr. Jyotsna, Vicky talked about the brands, or she actually mentioned about a brand as well, who kind of that maybe your company's competitor. How do you see this infodemic playing a role in this? And I want to specifically want to understand that is this infodemic problem is related only to pandemic, or we were always living amid some kind of infodemic, because people like you were always trying to kind of reach out to a certain vulnerable people, and with lot of myths and with lot of those misinformation always being readily available. Actually, as Archana also said that during the time of pandemic we have been much more concerned towards ensuring that misinformation is not getting any kind of priority as in these platforms. But previous to that, it was not that. It is not that the Google will put that, okay, for HIV AIDS, you need to believe this, or for this or this information, you need to believe this. Google has never said that earlier. it is now that when you search something, and even if somebody is trying to tell something, it will give you a reminder to you that, okay, if you are looking for a COVID-19 information, go to WHO site. It was not there earlier. So how do you see, was the infodemic more, kind of visible or rampant earlier before pandemic? What is your experience on that?
Sure. So it's been a pleasure listening to Archana and Nikki. I mean, there are a lot of points that I've noted down now. And it's a great question, Kamal, because doctors, I think, have been on the forefront of fighting the infodemic way before COVID. There have been a number of health issues. There have been a number of, there is still a lot of content on on the anti-vaxxer part of it, where people have doubted the efficacy of certain immunization programs or child immunization in general. So yes, definitely, this is the change, as you clearly highlighted, is that now everyone is concerned about the infodemic, because we've seen the impacts that a piece of information which, while not necessarily false, but reported in a certain way itself, can create so much panic. And these are unprecedented times, and a disease that is as long established as a TB, or say a measles, or even HIV, which has been around for almost 4 decades now. Even these diseases, while well studied, we see a lot of false information happening, and we see that doctors and health workers struggling to change these conversations or direct people to the right sources or the right facts. But yeah, the infodemic has always been there. And that's why, when COVID started, Reckitt as a company and brands like Dettol, like Harpic, like Lysol, we had to scramble to not just support people and governments in terms of product access, which we did through the Fight for Access Fund, but we also started a parallel channel where we were trying to communicate the right information as much as possible. So in 2020, especially, there was a panic that there were not enough masks, there were not enough, disinfectant soaps or whatever. So we did our bit. We committed and we delivered on, targets for ensuring that frontline workers had access to protective equipment. We also started COVID19facts.com, which has information that's updated with the support of, trusted organizations like Archana mentioned. They're so important in this support, where we had the facts which are vetted by the London School of Tropical Hygiene and Medicine, Johns Hopkins. We've, parallelly through our Baneka Swasth India campaign, we've, always roped in experts, Dr. Randeep Guleria and all the other doctors, some of whom have featured on this series as well, who have regularly come and spoken about burning issues. In 2021, we had to scramble to, the terrible second wave, we had to scramble internally and externally to support people with life-saving equipment and whatever support we could do for our employees as well. But at the same time, we were also pushing out or, fact checking on vaccine hesitancy and what's happening and what is the right way to go about it, and all the details, whatever we could verify, whatever we could vet, and whatever we could have experts backing us up on it. And Nikki is right that, when communications happen, the empathy part is crucial, especially when we are living in a VUCA world where things are changing every hour, not just every day. And it's information that reaches, someone who is connected, is living in an urban city with the internet, with some experience of handling the rate of information that's coming to them. I mean, channels like messages, like SMSs or WhatsApp, these have the potential of pushing out this, bite-sized information, which can be interpreted in n number of ways to people living in a rural area who may not have the resources to vet or verify. And who do they ask? So yeah, I mean, this infodemic is different. We've always had misinformation, but an infodemic, I think, is a new thing we've seen within this pandemic.
Thank you so much, Jyotsna. So it has been there. it has been impacting, but I think maybe the audience have gone larger, the mediums have gone bigger, or more numbers in its volume, and that is what is the infodemic is looking like more, I think, visible now. Let me go back to Archana, and you mentioned one thing that seen in the information, and Archana, it is also related to your points earlier. Ministry of Health, most of other major health organizations, WHO, they're all trying to churn out as much information as possible and in a lightning speed. But at the same time, the issue is also that the information nature itself, or the facts, or actionable itself are changing so fast, which is also, somehow making a certain kind of confusion among the recipients, because something which is in this fast moving pandemic or understanding of the virus, something which holds true today is not valid tomorrow. And it is possible that one set of recipients have only taken that information and are acting on that, which is, kind of, and for that matter, if we have seen that, let's say, for example, the changing protocol of COVID-19 in our country. So while we were all a lot more focused on, let's say, in initial protocols about, use of zinc, use of multivitamins, and, or maybe say hydroxychloroquine in the first wave, or then, ivermectin in the second. And then over the period, we realized that, okay, no, these are not doing more harm than good. So then we are changing, but at the same time, it might have got stuck with certain population. How do you see that? And what is the possibility of kind of keeping everyone along with you in terms of updated of information in the fast changing information scenario?
This is a good question, because everybody's highlighted this is a pandemic at scale, right? So this is not a disease that was really contained in a geography. This has impacted the world. So the scale is unprecedented. The scale is massive. It is not Spanish flu, because the channels of communications are very different today. We are talking about internet. There is instant information that's available to anybody. Today, I can know about what's happening in UK, what's happening in US, and this is a new virus. So the policies have evolved. You're absolutely right. The vaccines have come out faster, and even in terms of vaccine efficacy, the results are coming out real time. Just as the results are getting published, it's amazing that we get to know all these results almost instantly, right? I mean, there's so much of public information and very, very transparent information. But at the same time, what you're talking about is this learning which is evolving. And to that extent, I think the governments have kept pace in terms of making that information really transparently available to people as they learn more. This is a reality that there are no ready solutions, right? So there have been mRNA vaccines. They've never been produced at such scale so rapidly. They've come out really fast, which is really good, and people know about that information really fast, right? The good thing is that governments have kept pace, right? And the private sector, manufacturers have kept pace. Knowing the situation that exists, which is rapid availability of information. It is not the traditional approach of saying, okay, we will give out information on policy as, they've kept consultative approach. I'm not saying that they haven't, but at the same time, the speed of consultation and speed of response has been unprecedented. So I would say that you're seeing a different response from traditionally the governments and other actors who are slow in terms of disseminating of information. Today, they're not holding themselves back because it requires a different strategy, and those different strategies are getting deployed, which can lead to some sort of confusion, which is the point that you're making, which is like, oh, ivermectin today and tomorrow it's something else. But it is, as I say, it is a learning and evolving process. The governments are learning. the medical fraternity is learning. The medical fraternity is knowing much better, and as they know much better, they inform people, right? It is really important that the dissemination of the accurate information happens really fast, because the churn of infodemic is also, it's going on. So you have to keep pace with it. Can it be faster? Can it be done any better? I think retrospectively we will do all sorts of postmortems and no. But the good thing is that even the platforms are taking responsibility. You're right in terms of, Google, Facebook, Twitter. They realize that it's it is a situation where they have to come forward and support. Now you have to understand where these platforms also operate from and what is the philosophy, because they are open systems. They do respect freedom of speech, freedom of voice, and therefore they automatically do not take down content which could be harming people at large. But at this point in time, they're taking special. Their policies are different. They've come out with they are, say for example, prioritizing accurate information. For vaccines as well, the point that you had asked earlier, even anti-vaxxers, both Google and Facebook, had instituted policies to pull down content which was disinformation when it came to vaccines uptake. But have they done it consistently for other infections and other diseases as well? Hard to say. But I know that the global policies were adjusted for vaccines uptake for certain diseases.
Thank you so much, Archana. One point I would like to, and we will be, you mentioned about influencers, and while it is considerable and understood that in a very fast moving or changing scenario where the information is developing every day, and that is not that it is learning, and every day the new aspect of the virus, the movement or the response system comes out. You talked about influencers and using influencers for the purpose of giving the right, not only information, but also giving the right kind of impression on people so that they take a certain kind of action. With this, I can try to understand that many times in infodemic, or let's say in information space, there are unsaid words also. There are information which are not written, which are not spoken, but there are information, and they do make an impact on the people. How do they decipher that and how they act on that or react to that? While many of these institutions have maintained that there is a consistent delivery of right information, we also see many times, and I'm here talking about influencers, people who give a certain message with a certain act. We do see people leaving mask behind, people leaving, and the very influential people, being in big crowds. Again, the same trend is coming. If you see, many of our top leaders are being photographed in groups without any mask. Without any mask, in groups, more than 10 people in one photograph, you can see nobody wearing mask, or maybe 1 out of 10 wearing a mask. Do you see that these kind of information or impressions also create something which is infodemic, which harms people in somewhere, some level, when people start deciphering it in a different, manner?
Role models do matter, right? The point that you're making. So there is additional responsibility on role models. They have to walk the talk. They have to follow the same protocols as being advised to people. The pandemic is not going away. It's still there. Today, look at Africa. They are perhaps going to be, some of the African countries are going to go through the same wave or the devastating impact that we had gone through, right? So it is till the time the pandemic is over from everywhere, it's not over. It's not over in the world, right? So people will have to adhere to COVID appropriate behaviors for a very, very long time, even if they've taken vaccines. We have to wear a mask, we have to wash our hands, we have to maintain distance. It is so important. And the role models and the influencers have to display that responsibility as well. There is no getting away from it. I don't think that I can belabor on the point that you made anymore by saying I completely agree with you. COVID appropriate behaviors are going to be very important. And if we want the economy to get back, if we want the economy to kickstart, and if we want to go back to our offices, all of us are working from home. If we want to go back to our offices, it is so important that each one takes the responsibility, take the vaccine, follow COVID appropriate behaviors. There is no other shortcut. Actually, it is as simple as that. It is not very difficult. You have to take your jabs as they get available. You have to wait for your cue and then keep following those COVID appropriate behaviors. That is the only thing that can save us at this point in time.
So role models must, kind of make
role
the right.
Models must, yeah, social influence from a behavioral standpoint. Social influence really matters. Social influence is important for changing behaviors and get people to act appropriately. And therefore, there is responsibility of role models. There is responsibility on me as a role model, as my family follows me. As a mom, my children will follow me, right? So it is really important. Social influence matters. So it is whether a leader or whether influence that you have towards your smaller circles, we have to follow and just keep doing the right thing.
And the greater pedestal you are sitting in, the greater responsibility you have.
The greater office you hold, the greater responsibility. So in a way, it was good that, that our Prime Minister actually, he was talking about mask wearing for really early, and all his images, all his meetings, all his pictures have always had that gamcha or that mask, right? So he role models, and he's been role modeling for a very, very long time. I think others need to follow.
Yeah. Very important point, Archana, that definitely people should be, following that. Nikki, let me come to you, and now we'll try to wrap up and we'll try to understand that what are the ways to filter out, let's say, the misinformation, and make sure that it reaches to the people in the right manner, right shape, and right accuracy. You are working for many brands, mostly health brands and healthcare organizations. How do you, ensure that the brands you are representing or the brands you are working with are not adding to any kind of infodemic, and they are, putting their checks and balances in a manner that only the right, accurate, and the unharmful information reaches to the people?
Right, Kamal. So, Kamal, so as you have correctly mentioned, we are working for multiple healthcare brands. Keeping that in mind, it's very important for us to create a deep faith for the brands in the media and with their target audience also, right? If the common man is looking up for a particular brand, or if they are consuming news, they should not feel uncomfortable. They should have a trust, and they should have a connect with the brand. Just to ensure that we always cross-check our information, what we are floating in the media or for the target audience, it is multiple times checked from the doctors, senior doctors. Whatever information is going in the media for the brands, it's always vetted by multiple senior doctors. We have created the whole ecosystem for the right information, and we are not adding to the misinformation. So that's the entire process in our team, where in our organization we have a small team, as Archana mentioned about a war room. We have a small team which ensures that all the information going in the media is completely vetted by all the doctors, and then it's circulated in the media. We ensure the genuinity of the content. We ensure it has a scientific approach or not, it is backed by medical data or not. These are some of the facts, that accuracy of the content, accuracy of the information, the data that we are sharing. So we ensure that, because if one wrong information going in the media, we lose the whole brand connect. And it is very important for communicators to be critical and to very, in this agile world, I would say, where we are running to break the breaking news, to give the right information to the media.
Yeah, so Nikki, you are saying that it's very important for communicators to be critical and sometimes skeptic also before they are sending the information. Do you see the same, or do you see any challenge in terms of how the media take that information? Because many times, and even WHO has come up with the whole guideline that how to report a pandemic, how to report a vaccination thing. Because. And it very clearly says that don't go with just the executive summary of a report. Go deeper, try to find out what are the data, how the data was analyzed, all that. Do you see in an environment where you said breaking the breaking news, or something where you want to just push as early as possible, media is putting all those checks and balances to make sure that the only that information goes, which is hard to decipher into any other manner?
So, Kamal, very tricky question which you have said, but I will not like to, to be very frank. But to just add on here, what happens multiple times when we have to be a part of the breaking news, since we work for more than 16 hospitals in Delhi NCR, and we have more than 40 plus clients in healthcare vertical. Keeping that in mind, we always go again via doctors whenever there is any kind of a statement that we need to push it in the media or journalists, because as I said, huge number, we are working all day and nights in this agile world to give information to the media, right? So we always try to create, we also have our internal, policies and the internal checklist, which via that we do not prefer to share information with the media, to be very frank, because we are also answerable for the consumer brand. So we do our own research, avoid fueling the misinformation. We completely keep these things in mind, and reducing the spread, keeping that in mind, we always speak via doctors.
So you are saying that sending that information in the most credible manner and already vetted by possible major checks and balances, when they are taken care of, there are not lesser chances of that getting misrepresented or interpreted. Let me go to Jyotsna. Jyotsna, how has been your experience? And also I would request you to share your what are the tips you feel that one should follow, and then I'll go to Archana and Nikki and try to understand some actionable points that what communicators should follow. But one important thing, Jyotsna, I want to ask you to dwell upon is that, do you see that sometime media in a quest to make things more sensational, unique, end up giving information which sometimes is not aligned towards making a certain desired behavior from the public?
Right. So as Nikki was speaking, I did remember that there was also a brand trust study that was shared internally, which specifically spoke about the impacts of COVID on how people perceive brands, and not just corporates but also government, also healthcare, and across across these sectors, be it businesses, NGOs, government, or media, the trust levels have fallen. Consumers don't trust traditional sources anymore. They find that there's a lot of difference in the way facts are reported, or they don't trust the sequence of facts that are getting reported. And in fact, this study actually found that businesses have become more trusted, even when in comparison with NGOs and government, because I think as businesses there is always this pressure to be right. and what Nikki has mentioned about, the fact checkers and the need to vet every piece of information that goes out, even if it's a paid communication, it has to be true. So yeah, definitely there is a difference in the way people perceive things, and the role of media has become critical. There were communications by the Lancet. In fact, it was published in the Lancet. It's been published on the WHO site as well, that in the quest to push out information in a manner that is most likely to be picked up by the public and by other channels, there is a way, there needs to be a change in the way facts are reported as well. So the discussion that you had with Archana, as in, what people show versus what people speak, that you might tell people to wear a mask, but you don't wear a mask yourself. All these nuances, it also depends on how it is reported and how, the framing of the message. So yes, as a brand, we ourselves, Mr. Ravi Bhatnagar, I think, is the best person, to give you from his vast experience. But yeah, in the year I've been in, and my work started with the pandemic, the stress has always been to make sure that whatever we speak, whatever the brands speak or claim, everything is passed through an extensive vetting process. There is no, and this, I think, is a good practice. Information hygiene at every level, right from the sources of information to the recipients of information. At every level, if we institute, certain checks and balances, even as someone, sitting on a boat, on a fishing boat somewhere with a WhatsApp, and they see a message, the process that this person can follow to ensure that, they're digesting the information the right way, I think that is something that's going to serve us well in the coming years or decades as well.
Thank you so much, Jyotsna. So, Archana ji, your tips for the communicators, how to, kind of make sure that you don't add to infodemic.
So a lot has been said, so I'm not going to repeat myself in terms of all the other tips that one has spoken about, whether it's assessing the information, voice of science, etc. So I'm not. I think what we've not dealt too much about is the fact that hesitancy comes from the fact that people have different motivations, right? They have different, so to say, mind makeup. They have different motivations, and they act according to that. So therefore, it's really important to understand the motivation or the barriers that different people have for, say, for example, vaccine uptake, and therefore address that. It is really important. The same message doesn't go. You keep telling me eat sprouts because they're healthy. I will still not eat sprouts. I will go for a samosa. Right? Because my motivations are very different, right? So every individual has a different mind makeup. Every individual has different motivations. Same message does not cut across to everybody equally. It is different messages, the messages that would make sense and address the barriers. That is really critical. So way forward, looking now that the vaccines are available, looking now that you're asking people to come out and you're encouraging vaccine uptake, how do you get people motivated to come forward and address the barriers would be something that we at Gates Foundation are thinking a lot about. Especially this issue is going to be larger with rural populations and those who are remotely located. They are more vulnerable. So we are thinking a lot about that. I'll stop here. Thank you so much.
Thank you, Archana ji. Nikki, what's the point, what are the points you would like to share about making sure that information is delivered in a manner, as Archana ji also said, that it is more acceptable to the recipients. It is as per their mental makeup, and what are the other aspects must be taken care of.
Right, Kamal. So Kamal, according to me, one has to be very critical when you are consuming news, be it WhatsApp, social media, from wherever you are consuming. You need to be little critical. You need to analyze. You need to do research on that. Own research. You have to do your own research. Like on vaccination also, government came up with so many alterations, for this, for lactation mother, from, for, pregnant women, for suppressed immunity and all. So keeping that in mind, you have to do your own research. You need to cross-check your information before, as a healthcare communicator, I'm saying, get it vetted by key opinion leaders, doctors. I think that's the biggest influential in today's time, influencers, and we have to ensure the data, the things that we are communicating, it should be via them, means it has to, should be vetted by them. And we need to be empathetic, we need to show empathy, and fact checking is something which I really rely upon. So these are some of the 4-5 things from my side, because in my family I feel whenever my mother watches TV and she always come to me, okay, ABP mein ye dikha rahe hain, usme ye dikha rahe hain. So I always tell her, to do your small research just before believing on anything.
Yeah, thank you so much, Nikki, and I must thank all three our wonderful panelists, Archana Vyas, Dr. Jyotsna and Nikki Gupta. Very important insights you shared, and our audience must understand that it is the onus, apart from what is being pushed or what is being shared with you, the onus of I'm trying to figure out the right information. As Nikki said, the fact checking should also be on you. You are referring to only the right kind of sources. You are aware about which are the right sources for it. There are multiple of them, and clearly being prioritized also by many of these resource medium. So please, that is important aspect for all of us to make sure that the information which is being circulated, is spread, and being consumed is coming from the right scientific and kind of valid sources. So thank you so much, all three of you, for being with us. We will be playing a small gratitude anthem which ISW Council has especially created for our health workers, for our health heroes, for our corona warriors who have been doing wonderful job all three, these 15 months of time. And not only that, even before that, helping us stay healthy, protect our life, protect us from diseases, and also they will continue to do the same thing in the future. So we will be playing a song, and also after that is coming up, children from different schools of Delhi sharing their messages for our healthcare workers. So after the anthem, you will be listening or hearing a lot of messages from our children from different schools, sharing their gratitude for these health workers. So thank you so much, our speakers today, and it has been a pleasure hosting you, and also a very, very insightful session we had. Thank you so much.
Thank you, Kamal. Thank you.
Thank you.
Thank you.
Hi, my name is Padamjit Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes. आपका शुक्रिया. Thank you.
Doctor, it is a profession that may be considered a special mission, a devotion. It calls for involvement, respect, and willingness to help all other people.
Medicine is an evergreen profession. For as long as humanity is there will be illness and diseases. And there will be a demand for good doctors. In our bid to become one, the contribution of doctors deserves a special mention. They help us through the passage from our mother's womb to the earth and guide us throughout our lives, not only by curing diseases, but preserving and nurturing. They offer the much needed touch of empathy and care that brings solace in times of utter distress and helplessness. Even in the face of a pandemic, doctors have been relentlessly performing their duties and are leading this battle from the front, sometimes even at the cost of their own lives.
The medical profession is a profession of trust and honor because there will be never a dull moment in life. Every working day is different. Every patient is a new challenge. Ability to work with technology and cutting-edge science, helping others in incredibly significant way. You can wake up every day knowing that you have a chance to save a life. You can go to bed every day knowing that you've made a difference in someone's life.
Doctors are not God to create life. The next best thing to creating life is to save one.
At the time of challenges, even the place of worships are closed. But because of doctors, places for health and cure are always open.
दिन रात दौड़ती इस दुनिया में, क्या तुम्हें अपनी परवाह भी है? औरों की खुशी में खुश हो तुम, क्या इससे ज्यादा कुछ चाह भी है? नम आँखों की मुस्कान हो, तप त्याग की पहचान हो, उम्मीदें हो सबकी, दिलासे हो तुम। खुदा तो नहीं पर खुदा से हो तुम, खुदा तो नहीं पर खुदा से हो तुम।
We are forever grateful and indebted to you for choosing this noble profession to help and support mankind.
to cure and prevent the problems of the patient. In this current scenario, when the whole world is in the process of shutting down, the doors of the doctors are only open. Every woman's first and last event are certified by only doctors. In our job, not a single day is there when we go home without doing anything valuable for our society. I am blessed that wearing this white coat in dignity, I got the honor and privilege to serve the public. Thank you and happy Doctors' Day to all the doctors who are now working like soldiers in this pandemic.
Appreciate the service we do. As a doctor, you've gone above and beyond everything. You work so hard for 24/7. As we all know, that Doctors' Day also. On this occasion, I would like to thank you so much to all the doctors, which you have done for all of us. Thank you.
Hello guys, I, Yannick from MM Public School of Class 8 is here to show my gratitude towards all the doctors who have been warriors throughout this pandemic by reciting a thankful poem. Dear doctors, your healing art and science make the patients fit and fine. Nobody generally wants to know, but whatever medicine you give, make the disease glow. Your life is full of complications and sacrifice, but your profession is appreciable and nice. You are not only doctor, but a warrior. You dismantle every health barrier. Armed with stethoscope, dressed in white, against all virus, you are ready to fight. Life of a patient when in danger, role of yours is a game changer. You guard humanity like a ranger, even though the patients are nothing but a stranger. I need that beautiful mind like you. I want that beautiful hand like you. I also want to serve my nation. I want to be like you.
Morning everyone. Today I'm here to present a short speech on doctors. First of all, I wish Happy Doctors' Day to all the amazing doctors. 1st July is celebrated as National Doctors' Day in India. This day is actually celebrated in India to honor our one of the great physician, Dr. Bidhan Chandra Roy. Right now, the doctors are the frontline warriors, and in this pandemic, they are coming homes and fighting with the virus and treating the patients. So, they are called a real warrior during this pandemic. They are risking their lives to save our life. In fact, doctors got infected from virus and many of them even died. They are doing their job and helping the patients to get recover faster. May your day be wonderful and healthier as you make it for others. I want to thank you this Doctor's Day. You are an incarnation of God to others. Happy Doctor's Day. Thank you for being much more than just a doctor. You have been a doctor, a counselor, and a guide to be. I owe you so much in my life. Off to all the doctors for their hard work. Happy Doctor's Day. Thank you, Chitra Paliwal, 8th D.
मेरा नाम भविष्य शर्मा है। मैं कक्षा 7वीं सर्कल छात्र हूँ। मैं MM पब्लिक स्कूल में पढ़ता हूँ। आज मैं आपके सामने एक डॉक्टर्स के सम्मान में कविता प्रस्तुत करने जा रहा हूँ। जिसने बचाई हम सब की जान, ऐसे हमारे डॉक्टर्स को सलाम, ऐसे हमारे डॉक्टर्स को सलाम। खुद की परवाह ना कर सबका जो रखते ध्यान, ऐसे हमारे डॉक्टर्स को सलाम, ऐसे हमारे डॉक्टर्स को सलाम। परिवार को अलग रख सेफ्टी का रखते ध्यान, जो करते दिन रात काम, ऐसे हमारे डॉक्टर्स को सलाम, ऐसे हमारे डॉक्टर्स को सलाम। बिना भेदभाव किए सेवा करना जिनका काम, ऐसे हमारे डॉक्टर्स को सलाम, ऐसे हमारे डॉक्टर्स को सलाम। जीने की उम्मीद जगाते सबका जो हौसला बढ़ाते, ऐसे हमारे डॉक्टर्स को सलाम, ऐसे हमारे डॉक्टर्स को सलाम। नेगेटिव थिंकिंग हटा के पॉजिटिव सोच जगाते, ऐसे हमारे डॉक्टर्स को सलाम, ऐसे हमारे डॉक्टर्स को सलाम। मैंने तो आजमाया है, इन्हीं में खुदा को पाया है, इसलिए यह कहा है, ऐसे हमारे डॉक्टर्स को सलाम, ऐसे हमारे जीवन रक्षक को सलाम। धन्यवाद।
Good morning everyone. I am Akshat Pant from MM Public School. Today I am going to speak some lines on a doctor. Dear doctors, thank you for risking your life to save people from this pandemic. I appreciate your bravery and spirit. Thank you for putting yourself on the front line to combat COVID-19. Your experience and excellence played a big role in boosting up our confidence. Thank you, doctors.
My name is Mishti Panu. Today I am recite a poem on doctor. My poem dedicated to doctor. Let's start. Not only doctor, but a warrior. You dismantle every health barrier. And with stethoscope dressed in white. Again our virus, you are ready to fight. Life of the patient when in danger. Role of you are when in a game changer. Someone husband, someone wife. You save always people life. Facing situation difficult art. No doubt you are next to God. Thank you all doctor. Have a nice day.
International Doctor Day is celebrated on 1st July all across India. Doctors play very important role in this pandemic situation. So we should help our doctors to keep our India safe. First step is when we are coming from outside, we should use hand sanitizer and wash our hands. Second step is we should wear mask in a proper way when we are going outside. And third step is we should keep distance in a proper way in a crowded places. So then we can help our doctors to save our India. God is not everywhere. God sent doctors to save our life, and doctors save our lives. Thank you.
Hello everyone. I am Gitarthi Sunena Gaba from 8th A of MM Public School.
Today, I am going to present my gratitude towards doctors in my own words. As we all know that the outbreak of COVID-19 pandemic is upending lives at global level. During this pandemic, on one hand, people across India and globe are largely confined to their homes with educational centers and businesses all shut down. But on the other hand, the medical staff, healthcare workers and doctors are leading this battle against COVID-19 pandemic. So, putting their own lives at risk, they truly are the heroes in these challenging times. So, the least we can do is to appreciate their efforts and cooperate with them by staying at home. Thank you. Stay home, stay safe.
Hello everyone, my name is Atish Bhardwaj. Today I am going to recite a poem on doctors. Thank you, doctors today. You made and saved my day. Thank you, doctors today. Yes, I know what to say. Thank you, doctors today. Attending patients every day. List of advice to convey. Vitamin zinc every day. Help us to fight corona away. All work and no play. Even working on Sundays, no parties and no buffets, helping patients every way. Thank you for keeping corona away. Please accept my namaste. Thank you for services every day. Thank you, doctors today.
Good morning, everyone. My name is Satyan Gupta of class 33. Today I am going to recite the poem on a Corona warrior. So let's start. I have read somewhere that all superheroes do not wear capes. Oh, now I understood who they are. When the whole world is in pandemic phase, are policemen, sanitation workers, nurses and doctors doing their duties 24/7. They are not visiting their families for safety and protection. I believe their hard work will be paid and we will return to our happy days. I salute them with an gratitude and respect. Our warriors will definitely win and India will be free from COVID-19 phase. We see the real God in you. Happy Doctors Day. Thank you.
A very good morning to all. I am Piyush Singla. I study in 33. Today I am here to recite a poem. Thank you to our caregivers. Thank you to all of our caregivers. Your day and night became easier, but you didn't complain. You rolled up your sleeves and said, I'm here to help you. You smiled, you comforted, and pressed on under all the pressure. You continue to give your all and put patient first. You are our superheroes. You are our superheroes. Thank you for being a world-class caregivers today and every day. Thank you.
Good morning everyone. My name is Pardi Batra. I study in class 33. The title of my poem is Corona Warrior. I know there is fear. I know nobody comes near. I know people are ill. I know life is becoming still. I know there is a virus. But I thank the doctors with the white coat. They listen to our art and make us better with their art. I thank the nurses with the magic wand. They wipe our tears and when they are here, everybody doesn't have any fear. I thank the policemen with the star. When they are on feet, everybody walks nicely on street. I thank the sweepers with the mask. They pick up the garbage with their hand and clean every bit of the land. I thank the vendors with a smile on their faces and they fulfill our needs and make us feed. I salute to every Corona warrior and pray to God to remove this barrier. Thank you.
Hello everyone, myself Jonas Lal of class 4A3. Not all the soldiers carry guns to save the life of their country. Some carry stethoscopes. As the world has faced the pandemic situation, it has been our doctors, nurses, healthcare workers who have cemented their position as the foremost champions of humanity, saving humankind. I salute their courage, selflessness in serving society. No words are enough to express the gratitude towards the Corona warriors. All these Corona warriors who have risked their own lives to save the lives of others. It's unfortunate and great loss that so many of them lost their lives during this time. Our heroes or Corona warriors deserve high praise. They go so much beyond their call of duty to save lives and assure essential services. I give them a big salute. Jai Hind.
Good morning. My name is Kumari Navyasim. Today I am going to give a speech on doctors. As the world faces the crisis of COVID-19, it has our doctors and healthcare workers who have served selflessly. We salute to their courage in serving society. No words is enough to express love towards them as they risk their own life to save others. It is unfortunate and great loss for us that so many of them lost their lives during this time. As many as 646 doctors have died during this second wave of COVID-19, of which Delhi alone accounted for 109 deaths of doctors. Picture abhi baki hai and the show must go on were some of the last words of Dr. K.K. Agarwal, who lost his life due to COVID-19. He was recipient of Padam Shri. His videos are full of information about safety from COVID-19. The entire nation is thankful to the healthcare workers. Thank you.
मजबूर हुई जब दिल की दुआ तो हमने दवा से काम लिया वो नब्ज नहीं फिर थमने दी जिस नब्ज को हमने थाम लिया बीमार है वो जिस धर्म के है हमसे न कभी ये भेद हुआ सरहद में जो वर्दी खाकी थी अब उसका रंग सफेद हुआ तेरी मिट्टी में मिल जावा गुल बन के मैं खिल जावा इतनी सी है दिल की आरज़ू तेरे नदियों में बह जावा तेरे खेतों में लहरावा इतनी सी है दिल की आरज़ू
Happy Doctor's Day. Good morning, my respected teacher and my dear friends. Today, I am going to recite a poem on Doctor's Day. Thank you for the help and support, for the compassion that you show, for taking the time and care for me, and this I know. Thank you doesn't seem to be enough, all that you have seen me through. This world is a better place because of wonderful nurses and doctors like you. Thank you and have a nice day ahead.
Everyone, I am Ahana Amla of class 5A2. Today I am going to sing a song to show my heartfelt gratitude towards our doctors. So let's start. समर्पण को तेरे प्रणाम समर्पण को तेरे प्रणाम समर्पण को तेरे प्रणाम
समर्पण को तेरे प्रणाम। ममता का तू है दूजा नाम, समर्पण को तेरे प्रणाम। आपदा से ये रण तू है लड़ रहा, मौत का बढ़ रहा कारवां, तेरे हाथों से ही जग का आशीष है, तेरा जीवन तेरा ना रहा। इस पथ पर चले ना रुके ना डरे, विश्व तेरा ऋणी हो गया। सूरज की तरह तू अखंडित रहा, तेरा जीवन ही है प्रेरणा। समर्पण को तेरे प्रणाम, समर्पण को तेरे प्रणाम। हैप्पी डॉक्टर्स डे। धन्यवाद।
I, Ira Trivedi, is going to speak on doctor. D is for dynamic, O is for outstanding, C is for clever, T is for tidy, O is for observant, and R is for radiant. Here comes my doctor in many forms. They don't always wear a cap, a smile, or a word, or an action is sometimes all it takes. They help us without thinking, sometimes putting themselves at a risk. They could be a lifesaver, they could be a carer, they could look after our children or keep our country ticking. To me, my hero is my doctor uncle. A hero comes in a doctor. That is very true. Be happy, be safe. Happy Doctor's Day. Thank you.
To earn the title doctor is an honor. It is true. Fruition of a lifelong dream, achieved by just a few. For knowledge in and of itself is only just a part. The thing that makes you special is your kind and gentle heart. And when a doctor cares as much as you sincerely do, the world becomes a better place, no doubt because of you.
Hello friends, my name is Anya Garg. Today I become a doctor, one of the Corona warriors. Now I am going to recite a poem on all of us. From day and night, working hard to fight for others, they live, risking their own for a bliss. Months after months in the hospital, away from their close ones, they live a life captivated, working for others to survive. Let's be grateful for them, grateful for what they do. Thank them magnanimously, venerate them with full empathy. Thank you.
Hi friends, I'm Ishita Verma from class 5th B3 and today I'm going to share a few important information and also thank doctors and healthcare professionals for their contribution. As we all know, there is COVID-19 everywhere. Doctors and healthcare professionals are risking their lives for us. They are risking their families' lives too. They are just like warriors fighting the COVID-19 out there. It's just like a war zone out there. And everybody is fighting from COVID-19. When every country is fighting from COVID-19
credit to the doctors and healthcare professionals for their contribution. Thank you.
Today I, Harshika of class 5A1, on behalf of whole Indraprastha family, is going to pay tribute to Corona warriors or so-called saviors. Thank you so much for all your hard work and support during this difficult time. Dear brave healers, thank you so much for fighting against virus. You are risking your own life to save others, leaving your own families and having endlessly work. I really hope that this COVID would gone soon so that you all can rest. Not all heroes can wear a cap. I would pray that you all would reunited to your families. You all are true heroes for tomorrow's world. Now I want to recite some words for Corona war. कोरोना योद्धाओं को मेरा प्रणाम. कोरोना योद्धा कर रहे हैं ऐसा काम, कोरोना का हो रहा है काम तमाम. कोरोना के खिलाफ इस लड़ाई में पूरा देश कर रहा है इनको सलाम. पूरा देश मना रहा है इन पर पर्व, देशवासियों को हो रहा है इन पर गर्व. कोरोना योद्धाओं ने मन में ठाना है, कोरोना को हर हाल में हराना है. कोरोना योद्धाओं को हमारा प्रणाम, कोरोना योद्धाओं को हमारा सलाम. धन्यवाद.
Our heroes need to wear this dress all day long on this corona time. Let me tell you something about our heroes. What does it mean to be a hero? It's not those who live with ease or those who run away and hide. A hero is a person who encounters overwhelming adversity and stands tall under its weight. The person who has tried, tested, and often strained to breaking, yet rises stronger. The person who has battled and bled, instead of running away, they run towards. A hero say, I will, when others say, nothing at all. They volunteer, they sacrifice, they inspire, they care. They are warriors, the heroes. And to them, we say thank you to all our Corona warriors.
Hello and good morning to one and all. I, Praveen Kaur from class 3rd B2 is presenting a small poem as a tribute to all the health workers for working 24/7 and saving lives. So, the title of my poem is Doctors, the Real Heroes. When was the last time you thanked those people? When was the last time you appreciated their efforts? When was the last time you realized that they too can get hurt? They are giving their all for you. They have been risking their lives too. They are busy saving lives. They have left their families behind and have not slept from long time. It is high time. We need to stand with them and support. Till when we will keep quiet to this black hole? Let's acknowledge and appreciate their efforts they are making. Thank you, doctors, for standing strong and facing the adversities. I thank all the doctors of all the countries. I salute all the health workers out there. Thank you for being for us all the time. Thank you.
Good morning everyone. I am Tairaturi from class 3B2. Today I am going to speak a poem on our nurses. Nights so long they wear you down from room to room without a sound. Stands between life and death, returns that life with just a breath. Who makes the doctors look so grand, but it's hardly seen from where they stand. There's no seems to give or care. You can count on nurses, they are always there. You cared the sick and held many hands through the years. You laughed with some and with others you cried real tears. A nurse knows what complication each illness brings, but you did your duties like an angel without wings. Thank you to all the nurses of coronavirus pandemic. Thank you.
Hello everyone, I'm Vivan Malik from class 3B2 and I'm going to recite a poem on Doctor's Day. Not only doctor but a warrior, you dismantle every health barrier and with stethoscope dressed in white against all virus you are ready to fight. Life in the patient when in danger, role of yours is a game changer. Someone's husband, someone's wife, you save all these people's life. Facing situation difficult, odd, no doubt you are next to God. I thank all the corona warriors for their selfless services and all the sacrifices they have made. Thank you. Happy Doctor's Day.
कर भी बरसाएंगे, फिर भी उन्होंने अपने फर्ज से मुंह नहीं मोड़ा है। इतना कोसा है तुमने उनको, पर फिर भी उन्होंने तुम्हारी हिफाजत करना नहीं छोड़ा है। मैं घर पर हूँ, मुझे कोई डर नहीं। जो छपरी मौत की खबर कही अभी आजादी में महफूज नहीं, इसलिए घर ही है एक जगह सही। जरा उनकी सोचो जिन्होंने हमारे लिए अपना घर छोड़ा है। कुछ नाम ऐसे भी है जिन्होंने ड्यूटी पर दम तोड़ा है। मौत है हर खतरे में, फिर भी वो तुम्हारा कचरा उठाने आते हैं। दिल दहल जाता है उनके परिवार वालों का जब वो घर से बाहर जाते हैं। हम महफूज है, शुक्र बनाओ थोड़ा वक्त और, फिर दुनिया पूरी माफ होगी। फिर देना इनको इज्जत भरपूर, जब एक कातिल हवा साफ होगी, जब निष्पक्ष होकर सब जन सेवा में लग जाते हैं।
सलाम है उनको
जो इतना सब सहकर भी अपना फर्ज निभाते हैं। धन्यवाद।
Hello everyone, I am Dr. Anhad Singh Batra. I am a corona warrior. When doctors care, corona runs with scare. Doctors heal our pain so that we might gain. Thank you doctors for what you do and for just being you. Dear God, bless them all day long so they become super strong. I would like to thank all the corona warriors and healthcare workers for taking care of us in this pandemic. Thank you.
While the world struggles to survive a pandemic, there are angels with golden wings called doctors flying all over as saviors and warriors. Let's salute these national heroes. Salute you, oh dear doctors. You help the patients like no another. Hello everyone. I, Hamish Kanchandani of class 4B3 is going to recite a poem dedicated to doctors. White coat is like moon in darkness. Your name is like hope in illness. You do your best to cure us. We can see how you care for us. Your life is filled with all sacrifice, yet you deal with us so nice. You love your work with all your heart. The science of body is made an art. I also want a healing hand like you. I need that beautiful mind like you. I want to serve my nation. I want to help the patients. Happy Doctor's Day. Thank you.
Dear healthcare workers, thank you so much for everything you have done for us. Thank you for your bravery, your sacrifices, and your time who you have put together to make us people feel safe at our homes. We all know that we can't do anything without your support. As a school student who wants to become a doctor in the future, I feel so proud and supported seeing you all doing so much work for us and sending you all the love and positivity. You all people are doing such a great job and you all are so noticed and appreciated. We will always forever cherish your work and will cheer you on. Thank you so much for each and everything. We all love you and we all support you. Thank you.
Hello everyone, I am doctor. I treat sick people and give medicine. Bye. I hope you are fit and fine. Stay home, stay safe.
Hello everybody, myself Gauhit Chopra from Gyan Mandir Public School, and as you all know that today is Doctor's Day. We all are gathered here to celebrate Doctor's Day. Today I want to salute doctors for their hard work. So to salute doctors, today I am going to recite a poem for doctors. So let's start. Not only doctors, but a warrior. You dismantle but every health barrier. Armed with stethoscope, dressed in white, against all virus, you are ready to fight. Life of the patient when in danger. Role of yours is a game changer. Someone's husband, someone's wife. You save always people's life. Facing situation difficult on, no doubt, you are next to God. I salute you. Happy Doctor's Day to all doctors. Thank you.
Han and I'm from class 9th A. So today I'm going to convey some thankful messages to all the doctors and nurses on the very special day called World Doctors Day. The secret of awesome recovery is a doctor who is extraordinary. I'm very thankful to all the doctors and nurses for their hard work and support during this crucial time. Your humility, your kindness and your strength is greatly appreciated. Thank you for being our nation's guiding light in the face of adversity. Thank you to all the doctors and nurses for everything you've done for us to keep us healthy and safe. Thank you so much.
Hello everyone, my name is Mishika Madhu Sabharwal. Today my topic is doctor. A doctor is considered to be the god. A doctor is dedicated person. A doctor dresses white colored coat. A doctor treats sick people and give medicine. Some doctors are specialists like eyes, heart, specialists and extra. A doctor treats patients in hospital and clinic. Thank you.
सुना था डॉक्टर्स भगवान का रूप होते हैं। आज ऐसा लगता है कोरोना वायरस से लड़ने की चुनौती में भगवान ने ही डॉक्टर्स का रूप लिया है। नन्ही सी हंसी भोली सी खुशी फूलों से वो बाहें भूल गई। जब देश ने दी आवाज हमें हम घर की राहें भूल गए। हम सोए नहीं कई रातों से ए जाने वतन सो चांद पूजे। हमें नींद उसी दिन आएगी जब देखेंगे आबाद तुझे। तेरी मिट्टी में मिल जावा गुल बन के मैं खिल जावा। इतनी सी
है दिल की आरज़ू। तेरी नदियों में बह जावा, तेरे खेतों में लहरावा, इतनी सी है दिल की आरज़ू। हो 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 मजबूर हुई जब दिल की दुआ, तो हमने दवा से काम लिया। वो नब्ज नहीं फिर थमने दी, जिस नब्ज को हमने थाम लिया। बीमार है जो किस धर्म का है, हमसे न कभी ये भेद हुआ। सरहद पे जो वर्दी खाकी थी, अब उसका रंग सफेद हुआ। तेरी मिट्टी में मिल जावा, गुल बन के मैं खिल जावा, इतनी सी है दिल की आरज़ू। तेरी नदियों में बह जावा, तेरे खेतों में लहरावा, इतनी सी है दिल की आरज़ू।
याद करेंगे तो दूसरी तरफ चिकित्सक और चिकित्सा कर्मी की सेवा को, उस अहर्निश सेवा को कभी भी नहीं भूल सकते। तो मुझे विश्वास है कि हमारे जो ऐसे कोविड वॉरियर्स जिन्होंने अपनी प्राण की आहुति दे दी, मैं ऐसे बहुत सारे अच्छे अच्छे डॉक्टर को जान रहा हूँ। इसलिए आपने जो कहा है इसको निश्चित रूप से मैं अपने ऊपर जिम्मेवारी पूर्वक इस बात को कैसे आगे बढ़ा सकते हैं, मैं जरूर विश्वास करिए कि मैं इसको बढ़ाऊं।
आप मेरी ओर से, मेरे मंत्रालय की ओर से ये सभी फ्रंटलाइन फाइटर को उनका मैं अभिनंदन करता हूं, उनको धन्यवाद देता हूं। जिस तरह से उन्होंने इस पैंडेमिक में काम किया, ये तो सराहनीय काम था। और इनके वेलफेयर के लिए जैसा आपने कहा कि आयुष मंत्रालय कभी पीछे नहीं रहेगा, हम हर रोज आपके साथ रहेंगे, यही मैं आपको कहना चाहता हूँ।
कोरोना योद्धा के नाम पर अगर ये डॉक्टरों का अगर एक मेमोरियल हो जाता है, बहुत ही अच्छी बात है। आपका सुझाव बहुत अच्छा है। मैं हेल्थ मिनिस्टर डॉक्टर हर्षवर्धन से बात करूंगा। माननीय प्रधानमंत्री नरेंद्र मोदी साहब को भी एक पत्र में लिखूंगा। और बहुत सारे डॉक्टरों ने लाखों लोगों की जान बचाई है, इसलिए कोरोना योद्धा के नाम पर डॉक्टरों का एक मेमोरियल जो है, इनकी डेथ डॉक्टरों की हुई है, ऐसे डॉक्टरों का एक मेमोरियल जो है, ये मेमोरियल बनाने के लिए जरूर भारत सरकार की तरफ से जरूर हम कोशिश करेंगे।
Common man has so much faith in doctors. Ever since I've grown, like I can talk about my parents, me, children. Doctors are your first contact, and you always contact them, and there's a very long emotional relationship with them. So definitely, there has to be a celebration around it. There has to be. So we will do that celebration around it also.
Dr. Kamal, I have noted down your point, and whenever you actually put across this proposal, kindly also keep me in the loop. We can approach the Honorable Health Minister Dr. Harshvardhan, who is himself a very senior medical professional, and in fact known in India as the man behind the Pulse Polio program. And I'm sure he understands the nuances of all that we are discussing. And I'm sure we could be able to carry it forward. Very noble thought of yours.
Hello and a warm welcome to everyone joining this session of Gratitude Week, where we are celebrating National Doctors' Day for a whole week starting the 1st of July. Now we continue with our Thanksgiving marathon to thank our healthcare heroes for their untiring efforts and the service to the nation during the hard times of a pandemic. And we will carry this gratitude in our hearts forever, not one day, not a week, but forever. Now, all these days, we've been talking about how our healthcare heroes have risen to the challenge and taken care of their patients at the time of a pandemic. We've thanked them. We've also thanked the support staff and many people who have given their bits, Samaritans, caregivers, all those who have helped in tiding over this pandemic, the crisis that we have been facing. And now we also want to talk and show our gratitude towards the thinkers, the policymakers who've also stepped up the game and try to improve the messaging so that people are aware of the surroundings of what they can do to help themselves. Because COVID-19 is not just a health issue, it's also a societal issue. Much of what we do today will influence and shape how the pandemic will impact us in the long run. Now, early in 2020, when the COVID-19 pandemic broke out around the world, it became amply clear that we needed to change our own social behavior to break this chain of transmission. We tried lockdowns, but we have subsequently opened up, and the changes that were brought in included wearing masks and maintaining social distance in public spaces. Now, in a country where unsanitary conditions and poor hygiene lead to nearly 70 million cases of cholera, typhoid, diarrhea, and viral hepatitis over the 5 years to 2017, behavioral change may be crucial to success, but it's not always easy to achieve. Have we succeeded in drilling home the message that COVID-appropriate behavior is non-negotiable to beat this virus? Does messaging get diluted because new updates about the virus keep coming in, and the subsequent call for behavior change gets more confusing and contradictory? What are the most effective communication campaigns, and what more can we do? To discuss this, we are joined by a set of experts. Please welcome Dr. Sanjay Chhabria. He's a volunteer at Project Step 1. We also have with us Dr. Sanjeev Kumar, Chairperson in the Academy of Public Health. He's Chairperson of Indian Alliance of Patient Group, Chairperson Institutional Review Board, Gautam Buddha University, Greater Noida. He's a member of the Governing Board in IHFW, the Ministry of Health and Family Welfare, the Government of India. And we also have with us Madhusudan Srinivas, former Senior News Editor and Anchor, NDTV, and autism parent and mental health advocate. A warm welcome to all of you gentlemen. Thank you so much for joining us for this discussion. Dr. Sanjeev Kumar, let me come to you first. To what extent does messaging actually alter behavior and impact it positively? Could you give us some examples?
Thank you, Anisha ji. It's a pleasure again to be connected with IHW and this week of expressing gratitude and the great job IHW is doing in increasing awareness. Coming to your question, messages in health education are the starting point. We have to have clear, specific, actionable message which people can understand. If you give something very complicated with the top specialist wants to say something and nobody understands, that is not the right message. So it has to be simple message which is understood by a common person, and a common person can relate to what needs to be done. So it is the starting point, and we have a long experience in health in India on appropriate messages. You know, many messages are printed in our mind. For example, hum do hamare do. You know, from our childhood, even before I joined medical profession, that message is everywhere. We had messages for smallpox. The picture of the face, if you come across anybody like this, inform so and so. Then we had messages for immunization. I started my job in UNICEF as immunization officer. पहला जन्मदिन मनाएं तब टीके बच्चे को लग जाएं सब. You know, these are the messages which are very important, but they are just the starting point. You have to have from the message awareness, when people understand, relate to it, and then they are motivated, you know. And motivation doesn't come from the media. Motivation comes from family member, from people, from healthcare providers whom they interact with face to face. Then they go to trial. Oh yes, it is important, let me try it. So they try it, and then sustaining the behavior. For example, hand washing, which is promoted for COVID, is not just important for COVID, it is important for preventing diarrhea, many other diseases such as skin infections, respiratory infections, eye infections. So many of the diseases can be prevented. And this is what, if we can carry forward from what we have learned from COVID, it will prevent not just COVID, it will prevent many other diseases.
All right. Dr. Chhabra, you're volunteering with Step 1, and Step 1 has a whole roster of doctors who do consultations with patients. Now, even from doctors, sometimes we hear a few conflicting things. My father had COVID, and his oxygen had come down to about 90. So I got worried because, you know, the messaging was less than 94 is scary. So I called up an online consultation. I was told, please go to the hospital. And the hospitals had no bed, and the hospitals had no oxygen. But our father stayed at home. His condition was managed. He is completely recovered. Now, we all think, let's go to a specialist, and the specialist will tell us he knows everything. Who knows everything here? Because, you know, the advice also seems to change. The World Health Organization initially came and said, sabko mask nahi chahiye. We need it for the healthcare workers. And instead, everybody got to wear a mask. So we're like, what's happening? Who do we believe? I mean, how do we get over all these conflicting messages?
So, you know, you're absolutely right. I just did an awareness session with a corporate organization, and there was about 150 people over there. And, you know, they had requested me to talk about prevention and treatment, right? So, I mean, that's the standard stuff in terms of prevention, which all of us have heard over and over again. And any one of us that uses the phone gets it reinforced, like, you know, 10 times a day when you make a telephone call. And so I said, you know, there's really nothing new that I'm going to tell you in terms of prevention, but there are some key important things that I want to relate to you. And one of them, there were two important things that I shared with them. Was one is, let's understand the fact that this is a new disease. This is a new organism. We don't understand everything about it. So things are going to change. Things are going to continue to evolve. We need to have our eyes open. We need to have our ears open and stay abreast in terms of what's happening. Now, having said that, we also live in this time and age where there is information overload. So we have to apply information filters on what we have. And the healthcare fraternity has got a very, very important responsibility in terms of ensuring that they are staying abreast of what's happening. So at Step 1, one of the things that we do is we make sure that there is a dedicated group of people that are staying up to date with respect to what exactly are the latest protocol, what are the things that are changing, and making sure that all of the doctors that are within our community are spreading the same message. So that consistency is kind of got to be there, right? So I think while the healthcare fraternity has the responsibility of staying abreast, there is also sufficient layman information that is out there by means of which all of us need to stay abreast in terms of what's happening and go to sources where there is credible information. It's quite possible that a healthcare provider may or may not be abreast of what has happened latest. And at the end of the day, let's not forget that healthcare providers are also human beings. They may make a mistake. They may hear things wrong. They may do things wrong. We know that medical errors are something that are endemic to the entire industry, just like any other industry. There are errors that happen. So in these days and times, I think it's very important where we rely on credible sources of information and disseminate information where we can, by means of which there is a consistent method of delivery of care. So I completely understand, Anisha, what you went through in terms of go to the hospital, do this, do that, use steroids. In fact, I know that there were prescriptions when the second wave started, these pre-formatted prescriptions that were being touted as physician prescribed, saying that, use this, even if you have a slight fever, just use this, which is not the right way to do things, really. The intent was to provide protection to people, but now we know that really wasn't providing protection to people. Putting them on 2 doses of antibiotics, starting them on steroids right at the bat, was not the right way to really do things, right? So these are very, very complicated times, and we have to remember that the virus, like every other organism, is going to continue to want to evolve and survive and thrive in this environment. We have to stay abreast of what is happening in the research and the academic communities, based on which we are taking our actions.
Right. So that is, of course, the medical community. But the messaging is not going to happen until the media is also on board. And the media also disseminates the information, where mass media has a very important role to play. Madhu, you've been with NTV for such a long time. And this time around, the media has been called names. Initially, when in 2020, when the media would report about cases spiraling, people would say, why are people so alarmed? See, the media is fanning a fire unnecessarily, because a lot of people die of the common cold every year. Nobody makes a big deal about it. Now, the media is reporting what it please, but sometimes the call has come, have a little restraint, because you may make people go astray. What message the government wants in behavioral change should not have duplicate messaging from the media. What role does the media have to play here, in your mind?
Like you said, I had a vantage position because I finished my assignment with NDTV toward end 2019. And I had a vantage viewpoint in the run-up to the first outbreak of COVID, that's whether it's counted as January 2020 or March 2020. The media role began right there. Was Trump in denial in the US, or was India in denial in March 2020? Now, I don't want to go into the politics of it. The media is also in India is not one, organic organism. It's a many-limbed hydra in that sense, and the media has grown like crazy. There's conservative elements and there's very extreme elements, and unfortunately, I felt that in the initial hub of things in March and April, where we began with banging utensils, maybe, there was a section of the media which believed in what the government then wanted to say, whether that was the fact we learned the hard way through the first wave and through perceivably having overcome it by November and the complacence that followed, and the second wave that hit with much more devastation. Now, there are opinions about how it got covered. But from a personal viewpoint, not as just a media consumer, but as a resident of Delhi, I came across two aspects of the medical profession which I want to highlight. I lost a childhood friend who became a doctor through AFMC and retired from the AFMC and set up a hospital in Pataudi in remote Haryana, in a place where there was no hospital, 50-bed hospital within quite a number of miles. Now that one man from our class of 79, class 12, single-handedly advised at least 1,000 of us through two schools. I was born and brought up in Simla and in Delhi, the St. Columbus batch of 79, which helped him set up that hospital. He was in contact with practically each one of them and with people like me through our sons, daughters, parents, relatives. Each one's outbreak or impact of COVID felt right through and through. Now, this is I want to combine this personalized aspect. And tragically, the same person in the first week of June went to COVID himself, because much to his family's grief, he was affected in the first wave, and the family said, why don't you just sit back now? You've set up the hospital, let other people run it. You're turning 60, withdraw a little. But no, he was such a man full of service, just like so many others in the paramedical and the other sectors. I want to come to that. Where the messaging came from us for the media was basically, I watched NDTV as well as the other primary English channels. I must confess, not too much Hindi. But practically on every channel, there was Dr. Gileria through the year, and other top health professionals of the government, representing the government, giving mixed messaging, unfortunately. I think more than anything else, the mixed messaging came from the government, and the media swallowed it hook, line and sinker. Now, whether there's enough knowledgeable health professionals in the media to sift and to come up with data which could be critical, but criticism not taken as political but taken as professional, is a different matter. Now, similarly, what's getting, since our theme is gratitude, I want to end with this personalized note again, that on April 24th, my family came down with COVID. A next door family, we live in a journalist colony, came down with COVID similarly. The 66-year-old editor of a national level paper in the same lobby as me. Now, I was the only one who was tested negative, but my test was probably a false negative, because I showed symptoms. But like you mentioned in my introduction, I have an autistic boy of 28 years who doesn't go by he doesn't wear a mask, for instance. He has face sensitivities. We kept him in the house, and yet he was clutching me through his high fever of 104. So I had the symptoms, body ache, etc., but not this thing. So I convinced myself that I needed to be available for not just for me, but for the next door family. The next door family, the husband took ill. He wasn't wearing a mask, so he convinced. By then, that is the messaging where I blame the media, really. That masking message wasn't as widely and forcefully percolated as it needed to have been. And I think we were the primary role players in that. So this gentleman didn't wear a mask. His wife and son came down with COVID after he himself was hospitalized next door. And I live next door to the Max Hospital in Saket. And believe me, those tough days, the kind of messaging that both the Sanjeevs spoke of, very similar. The medical profession did all it could. We were just overwhelmed by the numbers, where differential messaging came at us from all directions in a panic. We have 2 or 3, at least 5 doctors within our society of 170 houses. They came up with plans. Everyone did isolate and everything. Despite that, we lost my neighbor's wife to her comorbidities. Now, by the time you tackle the comorbidities and the steroid response came up, again, we're in response. I have at least 3 friends right now who are dealing with steroid response. Do we have enough information in the ecosystem from the doctor community to all of us? I don't know.
Not just the doctor community.
What I'm saying.
Just the doctor community. The whole thing about steroid information. We still not clear about it.
Yeah, sorry to break in, but the larger message, the alarm I felt as a media professional is that not our doctors per se. The doctor community has done sterling stuff, and so have the paramedics and everything. In fact, my next door lady gained 14 days because a night nurse downstairs managed to hook up the accelerator at a time when nobody was available in the middle of the night. At 3 o'clock in the night, she fainted. And it was the night nurse who came up and figured out how to put on the accelerator the correct way. But it was the larger challenge to India's, what I'd like our doctors to concentrate on and for the future to look at, is the macro view of where is our healthcare system going. If Max is going to take 11 lakhs, I'm naming Max. I don't care because I have no stakes anywhere. And the bigger hospitals, if healthcare is available only at a price and not to the poorest of the poor. My fear now is that as it heads into rural India for the third wave, is there enough backup in the system, in the economy, to cope with the rampage into the rural system? That's what I'd like to pose.
That is where messaging is coming in, Madhu, because, in no country is medical infrastructure going to be enough. The last country is going to be India, where the population is so much. That is why messaging is so important. Dr. Sanjeev Kumar, now Madhu spoke about, how last year in March, people came out on their balconies and they were banging their thalis and making the noise just because the Prime Minister gave a call to action. May not be scientific, may not have had basis, but people did it. His one call made behavioral change. People did it. Now, do you think that any messaging can work if it does not have a call to action? You're saying wash your hands, wear a mask. Does it invoke that either fear or motivation or emotional connect to have a behavioral change? Can any messaging work unless it has that emotional connect with people? What do you think, Dr. Kumar? Dr. Kumar, you're muted.
So you raised a very important point, and Madhusudan ji also emphasized some of the issues we need to focus in an evolving pandemic. Some of the things we do, and you know better than me, you and Madhusudan ji know better than me, that tokenism does help. Banging plates, जो हमने थालियां बजाई या तालियां बजाई और वो जो पेटल्स डाले डॉक्टर्स के ऊपर, उन दिनों बहुत सारे डॉक्टर्स को घरों से निकाला जा रहा था. Their landlords were pushing them out of houses. Their families were discriminated because doctor is coming home, and many doctors, and I personally know my elder daughter, not in India but in the US, she is an infectious diseases specialist. For 2 weeks she stayed in the hospital. She had a 1-year-old baby. She didn't come home. She had to quit breastfeeding for that. The commitment, devotion, and the doctor I heard about in Patodi, that needs to be appreciated. Though I feel they should go beyond tokenism and make their work conditions better. The doctors were terminated from services when they demanded personal protection equipment in the beginning of pandemic. You close the court and then you pass orders that doctors cannot stay away even if they are sick or in quarantine. I think we have a double standard when it comes to dealing with doctors, but I will not go into those details. And you mentioned in the introductory remark correctly, it is an evolving disease. We are learning every day, and we should know who is the person to consult with, to bring on media channel who knows about epidemics. A clinician who is a chest physician, maybe heading a renowned government institution, does not necessarily make him an expert in that area. The guidelines issued initially had medicines which we know had no value. We knew when those guidelines were in. 2 antibiotics, imagine, for a viral infection. Yes, when you get a bacterial infection to top the viral infection, you can consider. Steroids started in the first week when there is clear indication that when steroids should be started. So there were issues there, but that does happen in a crisis situation. But we have learned a lesson that the doctors who come on media, doctors who are invited by people like you and Madhusudan ji, need to be expert in that area. Every doctor is not an expert in COVID. You need to keep that in mind. And then we had yo-yo behavior, both from public and from the authorities. We opened up. In Delhi, actually, we have had fourth wave, not second wave. Because when we opened up lock, stock and barrel. People thought it is over. Government has opened this, government has opened that. Mask went down, social distancing went down. And that yo-yo behavior needs to be contained both by authorities, and authorities' yo-yo behavior reflects in the public behavior. So they need to be consistent. Be cautious. When you're opening up, make sure that you open up gradually. And then there are bottlenecks we have in a crisis situation. As I said, things are changing. Nobody was prepared for this magnitude of the problem. The health system in the US was paralyzed. Health system in UK, Italy was paralyzed, and many other countries which were rated as the top. France was rated as one of the best health systems in the world, number 1. And all these countries in the Europe were in the first 10. Their systems got paralyzed. So we need to look at, in India, we were too much government hospital centered in the beginning, and then afterthought, when they couldn't handle, they invited private hospital both for diagnostics and admission. And they need to have better control, better governance. The fleecing 11 lakh rupees for treatment of COVID. People cannot afford it, and in a country like India, when average income is much lower than other countries which had crisis situation. Thanks, Manisha.
Right, Mrs. Sapir. So a lot can be said about what was done, what was spoken about, why people let go of their guards. But my question is that we can only treat as many people. We can only add as many hospital beds. And where will we just suddenly spring up the doctors to take care of more patients? It's not going to happen in the near term. It's not feasible. Our best bet is to get people to be knowledgeable and take their own precautions, so that at least on their part, they have done the best that they can. But Dr. Chhabria, I'm saying, when you are messaging to people, you're saying, wash your hands. Now, many villages, even water is not available. Many places, water is not available to wash your hands so as often. It may not be very practical to keep getting up from your desk and washing your hands over and over again. Now, the option is to use a hand rub, right? So when you're messaging to people to, adopt appropriate behavior, would you give them easier options? Would you give them options that they feel is, okay, fine, in my society, in my culture, this can be done. We know what is best. We know what is appropriate. We've got to make it work for people. So do you think our messaging is coming across where people relate to it and are willing to accept it because it's easy to do? It's not such a big deal.
So, the first thing is the message being done? Yeah, I'm having a little bit of a network. Can you hear me?
Yes.
Am I audible now?
Yes, please go ahead.
Okay. So, in terms of messaging, I'll speak from some first-hand personal experiences that I've had, and this is going back to way before COVID, right? We have household help that comes into our house every day, and look, this is going back several years ago when she was pregnant. And she had just started working with us, and she would come into the house and she would start doing work. And I said, no, doing work, wash your hands first, right? But this was not prescriptive. There was a component of understanding, of explaining to her important for our well-being and for her well-being as well. So behavioral changes take time, first of all. Let's acknowledge the fact that behavioral changes time, and in these COVID times, we've not had the time to be able to see this transition happen. Strangely enough, after a child was born, Hina is going to grow up into being a very, very healthy child because she started washing her hands before anything that she does at all, right? So in terms of messaging, how can it be done? It has to be done from the perspective of explaining to people. Same thing is with children, right? We tend to take for granted that children don't understand stuff, but when you explain something to a child, the child embraces it very, very easily. So this entire approach of, just this thing that you hear on the phone in terms of maintaining social distancing, wear your mask and wash your hands, it has to go beyond that, by means of which people understand why they are doing these things and what are the risks. Now, in terms of messaging, could we have done it more effectively? I've wondered why we have not. What I think works incredibly well in India are two forces: Bollywood and cricketers. Why have we not used these two people to disseminate mass messaging on a regular basis? Why are we not changing the ringtones that we are hearing on the same day? The same thing we hear every day. Why can those not be more entertaining? Why can those be not more reinforcing in terms of these behaviors? Because I am seeing that behaviors are changing. But why is it that we are not focusing as much on prevention? Well, infrastructure has to be developed, like you rightly said. We don't have the number of doctors to be able to take in the best of times, no pandemic. We don't have sufficient doctors to be able to meet the needs of our public. So why are we not investing a tremendous amount more of time and energy in prevention? Because the cost of prevention is far cure, and this is long-term systemic changes that will then persist beyond the pandemic. Let's not also forget that our heritage in terms of hand washing is something that is endemic to what we do. You know, you come into the house, हाथ को धो लो, खाने के बैठने के पहले, you know, wash your hands. I was watching, you won't believe it, I was watching Agnipath, the old Amitabh Bachchan Agnipath. These days you can go back and live down memory lane as much as you want. In Agnipath, which is, I don't know how old the movie is, it's probably about 40 years ago, Amitabh Bachchan's mom is telling him before she comes and sits at the thing, go wash your hands. Right. So these things are endemic. They are known to us. It's not difficult to be able to take these messages and magnify them a great deal, as long as we're explaining to people what needs to be done. Through all of the awareness sessions that we are doing at Step 1, we are ensuring that we are not telling people what needs to be done. We are explaining to them what needs to be done and why it needs to be done. Why should steroids not be used? Why should steroids not be used as soon as you have a fever? That explanation is there. So you have a more educated, a more informed consumer that's making the right choices for themselves.
All right. Taking your same analogy, Dr. Shabria, sometimes mere information is not enough. It doesn't change behavior. People smoking cigarettes knew they will die. It causes cancer. But only when you got those atrocious images on the cigarette packs, have we seen a little bit of a reduction in people smoking. Now, Madhu, I want to understand from you, from the media's perspective or from messaging perspective, should you put in shame? Should you put in fear? Does it work better to change your behavior? I remember that a campaign, of being in public or spitting in public, and there was a campaign which is to drive home this message. This is not acceptable. So, should we have public shaming or, shaming in messaging that this is not done, don't do it? Or, how do we make it cool? Like, the thing is that why were Bollywood and theaters not utilized? A lot was happening. Perhaps they lost a little bit of currency because the theaters were not open or the IPL got affected, whatever be the reason. Yes, getting influencers does get your message across. But then how? Do you get that shame? Do you get the fear? If you're seeing on the television that, oh my God, so many people are not able to find a hospital bed, they are out of oxygen, you would perhaps shut yourself in your home and lock yourself up. And then soon when things get better, you just forget. So what works? Does this fear psychosis, shaming work to get the message across?
Anisha, you've opened such a wide gamut of issues. And I must confess that although I'm 60, I'm not an advertising guru. But picking up from what Dr. Chabria was saying, and what Sanjeev had said earlier, Sanjeev Kumar, we've, unfortunately, at the time of the population explosion of the 70s or the polio campaign later, or smallpox and polio in tandem with that time, we had a newspaper-driven world. For whatever it's worth, even with the kind of literacy we had, those campaigns worked so beautifully at that time because I think the mass awareness then was carried on the shoulders of the, village level social worker. And there was a mass awareness of a certain, bache kam ped hazar or whatever the infamous emergency slogan or the other ones that Dr. Sanjeev Kumar mentioned worked beautifully. What I find, the change I find is with, पहले होता था अखबार में लिखा है डॉक्टर ने कहा है these were iconic givens and now unfortunately it's changed to it's not changed to fortunately कि टीवी में देखा था because टीवी में देखा था is a sure negative that maybe it's not true but WhatsApp में देखा है is a major the WhatsApp forward is a lethal weapon for which can work either way. So it could have worked this way and like Dr. Chabria said, the iconic figures, cricketers and Bollywood, there's an element of switch off now when you ring somebody up and get that patter messaging on social distancing, etc. After a certain while, there's an element of fatigue. So I think societally, what we need to do is evolve faster. Already we've lost time. In fact, 6 months, how long has the same message been pattering out on? It's installed on all phones and it's going on the same way. A little more imagination from the advertising community and the Bollywood and cricketer community, we are looking at positive messages. So to answer your question, I at least personally feel, for instance, every time my wife is a film critic, and perforce I drive her to a lot of movies and watch some movies now from the other side of the bedside all through this past year. Every time there's a cancer ad, I blanch and find other things to do. So the preventive messaging of a punishing sort, I don't know. Personally, I don't think it works. There's a turn-off element in it or a defiance element in it. I think positivity would work much better, and I think that's the kind of message Dr. Chabria is talking about, really. That some really strong stuff. It's the equivalent of the symbolism that Sanjeev Kumar spoke about. Ki thali bajana and this thing for the doctors, absolutely vital at that time. Why does we are evolving at this time halfway through this discussion. Apart from gratitude for the entire medical community, we are turning towards looking at positive messaging. And that's not going to come from your hardcore TV and newspaper correspondents who are going to look at data all the time and give you, new what's wrong or what's right. It's going to come from the ad and film world and cricket world. It's not going to come from,
That was a pretty incredible experience, actually. The Thali Bajana, the entire nation, forget the entire nation, Indians abroad were doing it. So if we are able to mobilize people to come together to engage in something that is for the wellness of the nation, this thing can happen persistently over and over again, by means of which it becomes part of how we operate. Let's not forget.
It becomes habit.
Yeah,
it becomes a habit.
Yeah, and there's plenty of speculation that's saying that, I don't know whether it's true or not, only time will tell, that this pandemic is eventually going to become endemic. It's going to be like the common flu, that we're going to just learn how to live with it, right? So we might as well start bringing in those changes right now, which over generations is going to sustain itself. It's a great opportunity for us to kind of get out of some of these things that have been systemic in our society for a long period of time. And yes, you're absolutely right. How do you guide a person who lives in a 150 square foot slum hutment with 6 family members? How do you guide them in terms of maintaining social distancing? It's just not realistic. So when that's not possible, you make do with all of the other precautions that you can to the best of your ability.
Definitely. So that is what I had said, that you're giving a message to do something, but it has to be palatable, it has to be acceptable, it has to be workable. Now, we are hearing that the government is looking to come up with information campaigns with influencers. MyGov, which is the government website for information dissemination, is already in the process of bringing in influencers so that the message comes across. Dr. Kumar, how much do you think influencers help? Because, Pulse Polio is given an example. Amitabh Bachchan's voice rang in everyone's ear and it worked. Our Prime Minister came and just said, Thali Bajao, everybody did it. Is this what is needed? The influencer to come in because people will believe them more than WhatsApp, more than the doctors. What do you think?
Anisha, there are two types of influencers. One is influencers who's sitting next to you. One is these public figures, Amitabh Bachchan and politicians and Bollywood and cricket icon. But the real behavior change, they give the messages, but the real behavior change comes with the people who are influencers sitting next to you. I remember when my daughters were young, and even my 1.5-year-old daughter now, we watch her on WhatsApp video. She is being taught how to wash hands. And I told you my daughter is an infectious diseases expert. And I am amazed how 1.5-year daughter can wash hands like this and do. So this comes from influencers who are around you. So the messages come from the influencers who are, icons in the society, but the adoption of behavior and sustenance of behavior comes from the influencers who are sitting next to you. Children enforce hand washing for parents, and parents enforce hand washing for children, and then it will be sustained. And mind you, during last 2 years, if you look at flu cases and flu deaths in India, came down substantially because the preventive measures are the same. Social distancing, wearing masks, hand washing, not touching your face with your hand, it brought down. And as Dr. Sanjeev Chhabria said, COVID is going to stay with us like flu has stayed from 1918, 99 pandemic. It is continuing for 100 plus years now. It is coming every year. So these behaviors need to be sustained. Yes, icons can give you messages, but behavior sustenance happens only with influencers who are your neighbors, who are your family members, and people you interact with in your social circle. I want to raise another thing on hand washing. Do you know there is not one international day, there are 2 international days. One is Hand Hygiene Day, which is 5th of May, and ISW, I'm very proud of being associated, had celebrated that. Then you have Hand Washing Day, 15th of October. There are 2 national days, and then there are icons promoting it. Even then, we don't do it. And people say no water. I have been part of international meetings, national high-level meetings with government officials and NGOs who are promoting hand washing. They participate. When they announce lunch, out of maybe say 50 participants, I only see 5 people going to the washroom in 5-star hotel, no shortage of water, washing their hands. 80 to 90% don't wash. You said water is not available. I will start with those who have water available. Why are they not washing hands and making an example for others that I, as a top doctor or a top planning person for water sanitation, I wash my hands, so everybody should wash hands. So these are the factors which need to be kept in mind when you talk about influencers.
Right. Dr. Chhabria, Dr. Sanjeev Kumar is saying that, at one point, having famous people, cricketers and film stars is good to get the message across, but to really imbibe in it in your everyday life, if people around you are doing it, if everyone's doing it, it becomes a habit. So now what happens is, we've been in a lockdown. Some of our friends are meeting each other, they're going out for drinks, and they're laughing at us. अरे तुम इतनी छुई मुई हो, घर पे ऐसे छुप के बैठी हो कि पता नहीं क्या हो जाएगा. So you feel that you are taking the precautions, but you're being made fun of. Can you do things safely so that everybody can get involved? And this whole peer thing, the whole family thing, that we will be careful. It will become second nature to us. How do you deal with this? That you want to be safe, but people around you are being very careless, and then you're feeling a little out of place. First, you want to go with them, but you're scared that they are not doing the right thing. You'll get into a mess. So, what should people do?
So there's 2 aspects to it, right? And there is the age-old cliche of be the change that you want others to be, right? So it all starts with self, right? So I don't care what my peers, mind you, it's a little different for me because I don't crumble under peer pressure. But at least I do have a lot of people resisting things that I've been telling, that I say during my awareness sessions, right? My entire stance from that, and I'm talking of like highly educated, highly accomplished individuals, my entire stance becomes to present you with objective evidence, saying, boss, this is not Sanjeev's opinion. I am just a recipient of the information that's stemming out from the academic community. I am not a practicing person. I am not embedded in research. I am not an infectious disease person, but I am a responsible person who's making sure that is staying abreast of what is happening. Let me present you with the data in a fashion that is not prescriptive, in a fashion that is not fear-inducing. Fear, kind of tangential thing. Fear, I don't think always brings about the right responses, right? You look at our traffic signals. When there's a cop over there, I'm going to stop at a red light. When there's no cop and I know I can get away with it, I'm going to get away with it, right? So in essence, if we are educating people in terms of why it is necessary for their own well-being, so it starts with me, my family, my own well-being. So then the message kind of is persistent over a period of time. So I think in terms of what I feel is, terms of creativity, we've been lacking in terms of how to do this messaging. We have so many creative minds in our country. You know, you see these T-shirts, what do they say? Apna din aayega, right? It's so widespread. Everybody knows about those things, right? There are so many messages that can become viral in our country because of the appetite of people to take this information and to kind of hold on to it. But it's got to be presented in a fashion by means of which it's sexy and cool, right? So, you know, you become part of the in community, but at the same time, there is a component of education in there. There's got to be that education component. Fear, I don't think, is a motivator, and that's a long philosophical conversation in terms of what the mitochondria does in the presence of a reaction, and how energy has to be harnessed either for growth or for survival.
No, I understand. Fear is not going to get us very far, but you know, what you said about making things cool and sexy, that is where influencers will come in, because once we look at them to imbibe on their behavior. So that is where the influencers will help. Now, Madhu, there is also a lot of misinformation. The WhatsApp University you just spoke about. I would like all of you to give a comment on this. I'll start with you, Madhu. How can one keep themselves away from wrong messaging? Because it's all over now, messaging. There is social media, there is mass media, there is personal WhatsApp. You don't know how to, find the right information. How do you save yourself from wrong information? What could be the best way forward?
That's a very, very tough one. I don't claim to have any correct answers to that one straight off, because there is too much of misinformation going on. But in a conversation, in a panel like this with the esteemed panelists as well as viewers, I would expect that you would identify credible information providers for yourself, whether from the medical community or from the media. What I wanted to mention, in fact, straight away, what I pulled out on my Instagram is a very dear friend who is an influencer. I'm not much of an Instagram person, but I believe, if you're talking campaigns these days, you cannot do without Instagram. And here's what my friend is saying. I'd like to run it past both the doctors here. She says, they called us after 1 month of staying in absolute isolation in the second wave. They vaccinated themselves and the one boy who was eligible over 18. And they've then called us home for dinner right in our neighborhood. And we sat at a social distance, had dinner, and came away. She put a picture on Instagram and says the way forward for us is to start meeting people who are double vaccinated. Incidentally, we are double vaccinated. To stick with the small group format, to mask up every time before we open the front door. Make no mistake, it's not over yet. This was just 5 lines. This works for me. Yeah. And this was spread far and wide because this lady whom I'm speaking about, is a teacher at Sri Ram School in Delhi and has a very wide circle of influence for various reasons, for whatever. But I think it works more than sifting out the misinformation. The focus should be on the positivity of finding out the right kind of information. And that I'm afraid I don't have I think the doctors on the panel would have a better clue as to where to source it from every time. And it also depends on I would say the neighborhood, the society WhatsApp group in this sense is highly avoidable. I've realized a lot of people have shut it off. And, because every time somebody peddles one fresh thing all through last year, that's what was happening. You went from what the doctors didn't mention, from remdesivir to plasma to whatever. And then at the end of 1 year, realize, all that was all bollocks, that none of it worked. So Anisha, I would say the focus should be more on what's not working. Leave that out and focus on what can work for you. That will come from the doctors, I think. Definitely.
Yeah, that will come from doctors, but what you said, for this particular person, finding like-minded people has worked for her. Now, I think, is that the way to go forward? Once you band together, once you're in the same wavelength, Dr. Kumar, would you then perhaps filter out
Anisha,
or go?
I just add one more thing, that having been a veteran of the media for almost close to 40 years now, 35 to 40, and I evolved from the print of journalism from the older days to television. What I see now over my last 13 years, I definitely say, for God's sake, don't hook on in the evening to the primetime television and come away with broad conclusions about the philosophy of life in general. Don't do that. That I can definitely say.
Okay. But Dr. Kumar, is this going to be the way forward? Find like-minded people who agree with your philosophies, and then once you start banding together, more people will come into your community. You do the right things, more people do the right things, and you will automatically keep the wrong behavior and the wrong information out.
Thank you, Anisha ji. Very interesting. In fact, I have been working on misinformation, and just this week an editorial is published in one of the public health journals on misinformation. I want to take you back in time. I am sure Madhusudan Srivastava ji will remember 1988, Madhusudan ji, 1989 as well. We had cholera outbreak in Delhi, and the epicenter was Trans Yamuna, Shahadra area, and I was teaching in University College of Medical Sciences, GDP Hospital.
GTP, I covered that at that time.
Okay. So you remember that. I don't know about others if you remember. I found one thing. I don't know which newspaper you were working for that time.
I was at the Hindu.
The Hindustan Times. Used to give news item every day, and in the end, what you should do and what you should not do. I have not seen any other newspaper, print newspaper, doing that approach. Electronic media has become very, very common, and yes, I will come to social media, and then I'll starting with print media. And you have lessons, I don't know, and news you can use. That's what we used to hear very often in 80s. We have stopped hearing that now. So news you can use, and that's what the Hindustan Times, one-page write-up, common man's education, lot of those things were done. In the electronic media, unfortunately, this 24/7 news has corrupted, if I would say. They have to show something or the other. They catch hold of any doctor who may not know about epidemic, maybe running a general practice, get them over and ask them question, and people feel any doctor is the right information. You get pain in your ear. Will you go to a gynecologist? No, you will go to ENT surgeon. So similarly, when you're talking of epidemic, go to people who understand epidemic. Yes, for clinical manifestations, go to a chest physician who has been treating. Go to those people who are treating cases. But everybody in today's pandemic has become an expert. They may be a clinician heading a hospital, has never gone out in the community, never studied the epidemics in the history. So that's the one thing which the electronic media has done. Coming to the social media, Madhusudan ji, I get an urge to withdraw from many WhatsApp groups. I am on many, at least 20 I counted. There were more, I stopped counting at that. I don't withdraw because if there is any misinformation coming, I step in. I say, no, this is wrong. And almost all these groups, people have stopped forwarding messages. A doctor working in so-and-so hospital has said this, and then you have a long list of do's and don'ts. Then I said, who is this doctor? I don't know, but he is a renowned doctor. What specialty? I don't know. So people are forwarding information without verifying. So my message to them is don't forward any information. Only if you are very sure it is an authentic information, you have verified it. Because there are quotations. I remember one professional group I am part of from AIMS, my community medicine public health expert group. Somebody forwarded a PowerPoint presentation with John Hopkins logo on it. And one of the inquisitive persons got back to John Hopkins. Did you issue this? No, we don't know. We have nothing to do with this presentation. We came to know only because you forwarded it to us. So even if there is somebody mentioning what is the source, it may be wrong. So the first message to deal with misinformation, don't forward any message. I would say err on the side of not forwarding, even if you have some information that it is true. The other thing I want to mention, Anisha ji, we have 4 groups in population. Unfortunately, we focused only on those who are sick with COVID. But we have people who are not yet sick. They need to be prevented from getting disease. Otherwise, your hospital will be full. You will keep waiting. More cases come, more beds, more doctors, more ICUs, more oxygen. That is not going to help. First is prevent infection in those. That did not get due attention. Media was only talking about bed shortage, oxygen shortage. What about people who were falling sick? And I like the message Madhusudanji mentioned. Before you open the door, put on the mask. There are only two ways. Either you will go out and get infection, or somebody will come home and give you infection. And in the second wave, almost the whole family got infected. Lot more than the first wave, because somebody brought infection. Even the elderly and the kids who were not going out, though, got infected. Second group is people with risk factors, and mentioned about comorbidities. Some of our friends and relatives have passed on to the next world because they had comorbidities. They need to be even more careful. I would suggest, God forbid, there is no third wave, hopefully, put them in quarantine, reverse isolation. Nobody goes and meets them. Any visitors, meet them from a distance and don't even enter their room. So we need to protect them. Third group is those people who have symptoms not yet tested. I am glad Madhusudanji followed that. Because you are losing time. In fact, you become infective 1 or 2 days before the symptoms come. The day you get symptoms, shut that person in a room, complete isolation. We did that. Fortunately, the symptoms became better after 1 or 2 days. Both my wife and me, she shut me in one room when I had slight fever. I shut her in a room when she had fever, tested and negative. Yes, fine. We recovered. So first symptom, isolate, otherwise you will spread infection to the whole family by the time report comes, and then those with the disease. So these are the 4 groups. We need to focus on each one of them. What are the appropriate messages for that? And we have a lot to learn, not just from COVID, from cholera, from smallpox, from polio. We usually don't reflect on positive experiences of that. Over to you, Anisha.
Right. Dr. Sabya, do you think we should bring in more positive messaging as well? Because, a lot of accusations the media has had to take that you've only shown us negative news. How far will negative news get us? Dr. Sanjeev Kumar is also saying, when I'm going to talk about helping people who have not been affected, isn't it important to message to them, bring in a behavioral change? What do you think? How do we clear out the misinformation and reinforce the messaging so that positive behavior change takes place?
So, I think that one of the things that works really well with children, which is what has made the entire digital education space become so prolific, is combining entertainment with education. I think that is a great way by means of which information can be disseminated. So, yes, I do agree that there has to be a lot more. Positivity may not be the best choice of words over here, but the entire fear-based propaganda of Mahamari IER and we are doomed and all of that stuff, I don't think has been clearly effective. So we need to now go to some alternatives and try to figure out what it is that we can do. And I know some, from some places that have had really, really good success by doing street plays. So it's basically weaving entertainment into education. In the rural areas where information is difficult to get, some NGOs have been very creative in terms of how do we get the information across. So they do street plays. So there is a storytelling component of it, which gets the message home. And then there is almost immediate change that is observed over there. There is more, the people are more curious to find out more information, and they're seeking more knowledge over there, right? So I don't know about quote unquote positive messages, but I think we have to look at alternatives, because clearly what we've done so far has not been effective from a preventative aspect. Clearly it's not been effective, right? I understand that social distancing may or may not be possible based on the density of population that we have, but I think there are other things that can be done. So if people are wearing masks appropriately in areas that do tend to be crowded, and making sure that masks are being put on properly, and making sure if they touch things on, they're sanitizing things, it was definitely going to control and to contribute to controlling some infections, if not a lot of infections, right? So the reality is we have to live with whatever environment we have in and make do the best with whatever else we can.
All right. Now we're coming towards the close of this discussion. I'll take last word from all of you. I request you to keep it a little short. Dr. Sanjeev Kumar, let's begin with you. We've discussed a lot. If there's just 3 takeaways that you would advise people to do so that they are better informed and take better decisions, make habits, what would they be? Dr. Kumar, you are muted. Request you to please unmute yourself.
Sorry. The messages need to be targeted to common person, simple language. It needs to be concise, like hum do, hamare do. It needs to be correct. You cannot give messages which are not correct, that you lose the trust. It has to be credible messages and consistency. I think Madhusudan ji mentioned that everybody from the media anchor to an expert to a man on the street should be giving those messages, and that also adds to the credibility. We always look for political support. I think we went overboard in political support. It became government support versus opposition issue. Many of the messages which government was giving were ridiculed, including vaccine, were ridiculed by opposition. I think too much of bringing in politicians, I always felt as public health person is good, but I realized that too much of that can also be harmful and counterproductive. Enforcement, both at individual level and government level, giving consistent messages, consistent message to the people that yes, enforcement is necessary, and these 3 or 4 messages need to be done throughout. Thank you.
All right. You need credibility and good enforcement as well. Madhu, your 3 things that people can do to filter out misinformation and
see at the end of it. At the end of it, having heard it all, I still emphasize the fact that the media's primary role will be to act as a watchdog and insist on accountability at every level. So your irritation level with go-getting reporting about finding fault with everything that the authority or the system is doing is at one level, yes, but it is crucial for everyone to be kept on their toes by those irritating reporters. It's very important. That shouldn't take away from the fact that there's cool-headed, calm analysis, data reporting of a very high order. Incidentally, I want to mention what Dr. Sanjeev Kumar said. It's come full circle. Some of the best work on the editorial pages of the Hindustan Times was done by the editor of the Hindustan Times, Sukumar. I forget his second name. On page 2, every day during the second wave, of an analysis of where we were at. A global view and an Indian view, both together. And it stayed from 89 in the Hindustan Times to now. Among other things, among the best data journalists in the country, a girl called Rukmini Srinivasan, based out of Chennai, who took a hard-nosed look at every bit of data released by the government. Another reporter, Vidya Krishnan. There are enough health reporters doing very good work, and the macro picture government needs to get used to being critiqued with a very hard-nosed messaging. The last one I'd like to lead with what Sanjeev spoke about. I was very inspired by that the media just doesn't include the hard-nosed reporters and the TV channels and the papers. It includes in a larger ambit the entire advertising and Bollywood fraternity. And what we spoke at, the iconic messaging needs to come with a hell of a lot of more creativity and more frequency and variety. Otherwise, public, you know how it is. आज एक picture चाहिए, अगले Friday को अगली picture चाहिए. वो bored होने का element बहुत ज़्यादा है. And that caution won't go away. From my own perspective, a very big caution, Anisha, I'm taking the 4th point. Our concern in the mental health community is not just for ourselves as the mental health community. We worked on my son 1 year to get from no mask to a mask up to the lips. It's taken us 1 year. Please allow the mental health, those with mental health issues, much more, allowance than you would give to anybody else. When you meet somebody, don't straight away presume that this is a violator. It might just be a person with mental health issues. But at the same time, you have to, at a different episode, I'd like to recommend, look at the mental health pandemic that's going to grow out of this, out of people being confined to their houses. You need to look at that very seriously. I've come across innumerable cases where people have asked for counseling from somebody like me as a parent, as what are you doing with your child confined to your house? And it's not just children, it's every age group. Every age group is facing, families are facing mental health pandemic, being confined.
Yes, we are going to talk about that also, Madhu, during this entire gratitude week. We are going to be discussing mental health tomorrow. Dr. Chhabria, your parting shot, what do you think was best in messaging to get the right habit?
Madhu's kind of touched upon it already. It needs to be fresh, it needs to be creative, it needs to be cool, and there needs to be reinforcement of these messages. I mean, just thinking, the famous dialogue from Diva, right? Mere paas maa hai. It would be so easy to say, mere paas corona se bachne ke liye tere paas kya hai? Mere paas mask hai. Can you imagine the impact of this and how viral it would go? How quickly it would go viral across the country and would result in change of behaviors, right? So I'm saying, creativity, bringing in influencers that have massive impact, I think can go a long way. A lot more effort must go into prevention. My entire focus on awareness right now is we don't know what the hell is going to happen in third wave. We don't know what mutations are going to there. We don't know what medications are going to work. We found out, now plasma is defunct. Right? We don't know any of that. What we do know is we can prevent ourselves from getting sick, and that is what we need to do. And prevention. And if you look at all of the countries where medicine is socialized, where healthcare is socialized, there is a tremendous amount of investment in prevention. Because it is not just prevention is better than cure. Prevention is also much, much more cost effective than cure.
Yes, much cheaper. Definitely. Thank you so much, Dr. Sanjeev Kumar, Dr. Sanjay Chhabria, Madhu. Thank you for joining us and brainstorming with us on what kind of messaging is required so that there is social behavioral change. We need creativity, we need reinforcement, we need credibility. And let's hope we will start walking that way. And everybody will accept these changes as normal, as become habit. And we will prevent corona spreading all over, COVID spreading all over, instead of just blaming the lack of facilities. Thank you so much. Thank you all for joining us. Pleasure to have you with us on this session. We'll take a very short break and we'll come back and talk about COVID and sepsis. Please do come back for that discussion. We continue to thank all the healthcare workers. Here's an anthem for our healthcare workers. Please do listen in.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
को लोग याद करेंगे तो दूसरी तरफ चिकित्सक और चिकित्सा कर्मी की सेवा को, उस अहर्निश सेवा को कभी भी नहीं भूल सकते। तो मुझे विश्वास है कि हमारे जो ऐसे कोविड वॉरियर्स जिन्होंने अपनी प्राण की आहुति दे दी, मैं ऐसे बहुत सारे अच्छे अच्छे डॉक्टर को जान रहा हूँ। इसलिए आपने जो कहा है इसको निश्चित रूप से मैं अपने ऊपर जिम्मेवारी पूर्वक इस बात को कैसे आगे बढ़ा सकते हैं, मैं जरूर विश्वास करिए कि मैं इसको बढ़ाऊं।
आप मेरी ओर से, मेरे मंत्रालय की ओर से ये सभी फ्रंटलाइन फाइटर को उनका मैं अभिनंदन करता हूं, उनको धन्यवाद देता हूं। जिस तरह से उन्होंने इस पैंडेमिक में काम किया, ये तो सराहनीय काम था। और इनके वेलफेयर के लिए जैसा आपने कहा कि आयुष मंत्रालय कभी पीछे नहीं रहेगा, हम हर रोज आपके साथ रहेंगे, यही मैं आपको कहना चाहता हूँ।
तो कोरोना योद्धा के नाम पर अगर ये डॉक्टरों का अगर एक मेमोरियल हो जाता है, बहुत ही अच्छी बात है। आपका सुझाव बहुत अच्छा है। मैं हेल्थ मिनिस्टर डॉक्टर हर्षवर्धन की बात में करूंगा। माननीय प्रधानमंत्री नरेंद्र मोदी साहब को भी एक पत्र में लिखूंगा। और बहुत सारे डॉक्टरों ने लाखों लोगों की जान बचाई है, इसलिए कोरोना योद्धा के नाम पर डॉक्टरों का एक मेमोरियल जो है, इनकी डेथ डॉक्टरों की हुई है, ऐसे डॉक्टरों का एक मेमोरियल जो है, ये मेमोरियल बनाने के लिए जरूर भारत सरकार की तरफ से जरूर हम कोशिश करेंगे।
Common man has so much faith in doctors. Ever since I've grown, like I can talk about my parents, me, children. Doctors are your first contact, and you always contact them, and there's a very long emotional relationship with them. So definitely there has to be a celebration around it. There has to be. So we will do that celebration around it also.
Dr. Kamal, I have noted down your point, and whenever you actually put across this proposal, kindly also keep me in the loop. We can approach the Honorable Health Minister Dr. Harshvardhan, who is himself a very senior medical professional, and in fact known in India as the man behind the Pulse Polio program, and I'm sure he understands the nuances of all that we are discussing, and I'm sure we could be able to carry it forward. Very noble thought of yours.
History shall bear witness that when the time came and humanity needed to be saved, it was the doctors who stepped up to answer the call of duty.
WHO के द्वारा जो ये आपने डॉक्टर्स डे पर, चिकित्सा दिवस पर इस कार्यक्रम का आयोजन किया है, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ।
Congratulating the Integrated Health and Wellbeing Council for this unique gesture to honor the doctors and other people in the medical community who are the most dependable resources to fight this pandemic.
7 दिनों में भाग लिया है, तो सभी का मैं धन्यवाद करता हूँ। डॉक्टर डे के अवसर पर दुनिया के सभी डॉक्टर को, भारत के सभी डॉक्टर को मैं शुभकामना देता हूँ, हार्दिक बधाई देता हूँ। जय भीम, जय भारत।
I would really say the doctors have actually risen to this challenge in this unprecedented times, and that is something which is very heartening, not only in our country but at a global level.
We got to get together to support a true legislation and a strict legislation of against assault to doctors.
We need to be really serious about and have a rethink about the final delivery system we need to adopt about the delivery of healthcare. Should it be state versus the central?
By communication, having compassion,
having empathy, feel the pain of the other person.
Having said that, have three attributes: sympathy, empathy, and compassion.
There is a lack of empathy. Probably that is one thing I can agree with that, but there are other issues that many a times the doctor is helpless.
Younger population is definitely, active. That is why they are more, exposed to infection, and we cannot say that they are less or they are going to be in future.
So definitely there has been an improvement in the number of stroke patients coming to the hospital, but it has not still reached the pre-COVID level numbers.
What COVID did to especially India, one, it disrupted the NCD services totally. The second most important thing it has caused.
We need to talk to actual people in the Center for Disease Control, the virologists, people like you who are on ground. We need to understand and fight this scientifically.
Yes, the fear is still there, but as I said that the passion is to hear one day that India is a developed nation.
खूब लगा लो पहरे रास्ते रब खोले
न जाने आस पास है खुदा
Session of Gratitude Week from the 1st to the 7th of July, we continue with our Thanksgiving marathon to thank our healthcare workers, our heroes, for their untiring efforts and service to the nation during the hard times of the pandemic. We will carry this gratitude in our hearts forever, and we are celebrating for a week, but we will carry this gratitude forever. And we want to thank our doctors for going beyond the call of duty and serving the patients to the best of their ability. At the same time, we have a few awareness sessions during the Gratitude Week in a bid to empower people to take charge of their own health so that doctors can have better informed, more aware and highly alert patients. This, we hope, will also make the doctors' practice more fulfilling. Now, in this awareness session, we're going to talk about sepsis in COVID-19. This session is supported by Udit Pharma, and we thank them for their support. Now, a recent study by the All India Institute of Medical Sciences, Delhi, has revealed that patients under the age of 50 succumbed to COVID-19 more than those above 65. And this study has begun after the second wave. And this is the data which is coming through, that younger people have died, more younger people have died in ICU than those who were above 65. It also says that sepsis with multi-organ dysfunction was the most common cause of death. Now, this is a retrospective study covering adult disease patients that were admitted to the ICU from April 4th to July 24, 2020 in AIIMS, Delhi. Now, first of all, what is sepsis? Sepsis is the body's overwhelming and life-threatening response to infection that can lead to tissue damage, organ failure, and even death. When the body is exposed to an infection, our immune system releases a number of proteins called cytokines that control inflammation in our body. Unfortunately, sometimes the body goes into overdrive and releases more cytokines than it should. As the body loses control of the cytokine production, it results in what is called cytokine storm, which can then progress into sepsis. Now, we've heard about cytokine storm because of COVID in the recent past, but now we're hearing about sepsis. So will all patients that undergo a cytokine storm progress to sepsis? Does the presence of comorbidities like hypertension and diabetes increase the risk of sepsis in patients? What are the symptoms of sepsis and how can it be managed? To discuss this, please welcome our esteemed set of senior doctors who are joining us to discuss this topic. We are very happy to welcome Dr. Urvi Shukla, in charge of Pastoral Critical Care and Emergency Services, Symbiosis University Hospital and Research Center. She's joining us on this call. We're also very pleased to welcome Dr. Vijay Mishra, Medical Director, BNMSH, and Director, Medical Institute of Critical Care. In some time, we'll have our other panelists joining us, Dr. Anil Gurnani, Group Director, Critical Care, Kailash Group of Hospitals, Dr. Mohammad Akbar Shah, Associate Professor, Critical Care Medicine, Sher-e-Kashmir Institute of Medical Sciences, Dr. V.T. Devaprasad, Critical Care Specialist, Apollo Hospitals, and Dr. Abdul Ansari, Director, Critical Care, Nanavati Hospital. A warm welcome to all our guests, all our doctors joining us for this discussion. Dr. Shukla, let me begin with you. First of all, we want to understand the whole concept of sepsis. Now, pre-COVID-19, sepsis was usually caused by severe bacterial infections, and during the last year, we've seen more cases of sepsis come up because of a viral background. The virus here is the coronavirus. Now, is cytokine storm the same thing as a sepsis? What really is happening, with coronavirus and sepsis in our country now?
So yes, as you say, Anisha, am I audible?
Yes, ma'am. Please go ahead.
Okay. So as you say, yes, we have seen a huge number of patients with sepsis, almost all of them secondary to COVID-19 disease. And this has been because of the pandemic that started in March 2020. So a cytokine storm. So this terminology was actually created once we started to realize how the COVID infection was affecting people. But a cytokine release happens with any kind of an infection. It could be bacterial, it could be viral, or it could be any other organism which creates a dysregulated inflammatory response within the body. So every cytokine release syndrome, will it cause or will it progress to creating organ dysfunction? Well, that we are unsure of right now. We don't know why certain patients progress to developing multi-organ failure and why certain patients, in spite of having high CRP values, high oxygen requirements, will not progress to organ dysfunction. As in, so we say that COVID-19 affects primarily the lungs, but in certain section of the patient, it also affects other organs, mainly the heart, the kidneys, the intestines, and brain. So why certain patients progress to affection of these other organs is kind of a mystery right now.
All right. But you're saying that we cannot say for 100% whoever gets a cytokine storm because of COVID is going to have sepsis. Is that what you're saying, Dr. Shukla?
Sorry, I didn't get this question.
My question is, you're saying at this point in time, we cannot say conclusively that everybody who gets a cytokine storm because of the COVID infection is going to have sepsis, right?
That's right.
Okay. So there is no 100% correlation, but I want to see and understand what you are seeing in your practice. Now, let me come to you, Dr. Vijay Mishra. Dr. Shukla has said that she has seen an increase in sepsis cases. What about you? Have you seen an increase in sepsis cases in your practice? We had a study coming in from AIMS saying that the number one cause of death because of COVID is sepsis. What are you seeing in your practice?
I do. Good afternoon, everybody, and thanks ISW for inviting me here. I do agree with what Dr. Shukla says that yes, a lot of COVID patients have had secondary sepsis, and the cytokine storm that's generated by COVID has not been defined as a sepsis, even though the picture is similar to the sepsis, right? So that is one thing, and a sepsis on top of COVID-19 has been a very prominent finding, very common finding in all the sick COVID patients. The presentation is more or less similar, both in sepsis or in COVID. when would you call it a bacterial sepsis or another super added fungal sepsis is after you have isolated one of them, right? So, which has been not very easy in COVID patients, more so because the infection was always, not always, but almost always associated with pulmonary involvement. And getting the samples and proving it beyond doubt that these are sepsis patients were not always easy. So, if I had to summarize that, do I agree with what Dr. Shukla says? Yes, certainly I do agree. But not all COVID patients got sepsis, but a lot of them got it. And it has been a challenge treating secondary sepsis in COVID patients because these patients were immune suppressed. They have had cytokine storm because of COVID and also because of secondary sepsis. And the COVID required us to use immunosuppressants, which is actually detrimental when you have a secondary bacterial sepsis. So it was a big challenge, and yeah.
No, secondary bacterial sepsis. Now, Dr. Ansari, what have you seen? What I have given to understand is that the sepsis is being caused by the virus, which is coronavirus. Usually, sepsis has been used to happen because of bacteria. Now, the virus directly is causing sepsis. Could you say this conclusively? Have you tested to see that there is any other secondary bacterial or fungal infection causing sepsis in COVID patients?
So thank you, Anisha. First of all, warm regards to all, and thank you, ISW, for inviting all of us on this interactive platform. So I think we need to just go back a little. When we talk about sepsis, has been variously defined, but latest in the sepsis 3 guideline internationally, it has been defined as a life-threatening, organ dysfunction, which is because of any trigger, which is a pathogenic trigger, which could be bacteria, fungus, or a virus. And that very clearly means that there is a trigger which causes your bodily immune response to, go in either hyperdrive or leave the scene. So either it is hyper or hypo-inflammatory response to a pathogen causing life-threatening organ dysfunction. So if you look at all this, it's like there is a key which gets unlocked, which causes your organ dysfunction to, go out of hand and cause so much of damage that the patient is on the brink of death. Now, coming back, when we talk about COVID-19 induced sepsis, now viral sepsis conventionally is not something we always talk about. Virus causes a kind of inflammatory response, but the sepsis word was usually reserved for bacterial infection, but not limited to. So when you say viral sepsis, it's a definite entity, and we are talking about COVID causing a kind of immediate viral replication, causing organ dysfunction, in this case primarily pulmonary organ involvement, and then causing a simultaneous host immune dysregulation. And this allows, because of the usage of contemporary steroids and other medications, immunomodulators, which we'll talk about that later, can cause reactivation of infections, either bacterial or fungal infections and other opportunistic infections. So this is very interesting when you look at how it unfolds. There is a viral infection like COVID-19, which causes a complex interaction with the host cells, causes the host cell to go into immune disarray. And that leads to a complex chemical problem like cytokine storm that we talked about before, or also predisposes the host to multiple secondary opportunistic infections, either bacterial or fungal, or even secondary viral infections. So I hope I am not confusing, maybe simplifying it for all of us.
Right. I'm still trying to understand whether it was clinically proved that the sepsis was caused by the COVID, by the coronavirus, or was it something else at play? Dr. Ansari, could you clarify for us that was it because of the viral, or was it proved that it's only the virus?
So
something else.
Thank you. So Anisha, this is called as a second hit theory. So the first hit could be sometimes trauma. So let's examine a 20-year-old young boy who get a bad trauma, head injury, and comes to the hospital. He's on a ventilator by virtue of his head injury, and he's on a ventilator. After 7th or 14th day, you may find that he now gets a fever. And this fever, when you investigate, you find either is because of a central line in place or because of the very fact that he's on a ventilator or he has a urinary catheter. Now, when you investigate, you will say that yes, he has developed a secondary bacterial infection if you isolate a bacteria. Now, come back to COVID. So a person comes with COVID-19 associated acute respiratory failure. There will be mild, moderate, severe presentation. The severe one comes to the ICU, needs a lot of intervention, including a lot of invasive lines and a ventilator, and also heavy immune modulatory drugs. Now, this creates a kind of a situation or creates a substrate for secondary bacterial or fungal infections to come at various timelines. To say that the virus has directly caused a sepsis may be not completely true, but it has definitely triggered a situation where secondary infections have kind of come in, would be the true position. I would probably say this way.
All right. Dr. Dev Prasad is also with us. Dr. Dev Prasad, in your practice, what have you seen over the last year and a half? Have you seen increased cases of sepsis in patients who have COVID-19? I mean, is it hard to manage sepsis? Because if sepsis is not managed proactively, you see organs shutting down and ultimately death happening. What has been your experience in your practice?
I was just not very clear. Can you just briefly tell me again? In the last month, last year?
I wanted to know what is your experience in the last 1 year? Have you seen increased cases of sepsis in patients with COVID-19?
Okay. Now, I think it is a very interesting conversation that we are having, whether COVID-19 per se can be called as viral sepsis, or is it a secondary infection that causes sepsis. So just, I know most of us have varied opinions. Just to give a different perspective, probably just highlighting what Dr. Ansari said. So if you look at the latest definition of sepsis, it says any life-threatening host response, which is a dysregulated host response to an infection and which causes organ dysfunction. And how do we define organ dysfunction? You define organ dysfunction as a change in your SOFA score, which is your sequential organ failure assessment score. So we look at about some organs. We look at the brain, we look at the heart and the lung, we look at the kidney and the heart, kidney and the liver, and the blood. That is, you look at the platelets. So if there is a change in it, meaning to say in the brain, if there's a drop in GCS, if in the lung there is an increase in the PF ratio, in the heart, if the patient has got hypotension, if there is bilirubin rise, if there is creatinine rise, or if there is a decrease in the platelet, if any of this were to happen, and if two or more organs were to be involved, and then you have a fall in the SOFA score, then it meets criteria for sepsis. So if you're going to ask me, well, do you want to say that COVID-19 per se causes sepsis? Maybe if you're looking at this definition and looking at it impartially, yes, I would say that you have viral sepsis induced by COVID. But having said that, most of us don't want to accept viruses as causing sepsis. We traditionally define as bacterial sepsis, fungal sepsis, etc. So traditionally, probably because of the thinking, we don't want to actually define it. But strictly, if we go by the criteria that has been laid down for defining sepsis, COVID-19 per se can cause or is causing viral sepsis. So I would answer that. Second, if you are asking me traditionally, are you seeing a lot of cases of secondary sepsis, that is secondary bacterial sepsis or secondary fungal sepsis because of COVID? Yes, that is. Most of the patients who come into our ICU and who survive because they have needed organ support for a long duration. And any patient who spends a significant proportion of time in the ICU, and because of the treatment that they receive in terms of immunomodulation that we have to necessarily use in terms of COVID, be it steroids, be it tocilizumab, be it baricitinib, whatever it is, all of them do have an immunomodulatory effect. They predispose to secondary infection. So we see a lot of secondary infection that involve the lung, that involve the lines that we have used, that involve the urinary tract. We've always seen fungal infections as well. So yes, primary viral sepsis definitely, and also secondary, a whole lot of sepsis as well. Yes, I've seen it in the last year. Thank you.
Right. Dr. Shukla, I think all of you have spoken about sepsis in an institutional setup. where patients are already admitted and you have seen the development of sepsis. Now, what are the signs of sepsis? If I'm not in institutional care, if I am not in a hospital, could I have could I be getting sepsis? How can caregivers be watchful of what are the symptoms of sepsis? Dr. Shukla, if you could unmute yourself, you're muted.
Even if we keep COVID aside here, so signs or symptoms of sepsis, is that what you're asking? So patient who is not institutionalized so far.
Yes.
Okay, so like Dr. Ansari previously mentioned, that there has to be a trigger, something that will unlock, so the key to unlocking that whole syndrome. So the patient needs to have some kind of an infection, whether proven or at least a suspected infection. And once there is an infection of either a bacterial or a viral source, we speak of virus because that is what we see in last 1.5 year most often, which becomes the trigger. And once you have that source which unlocks the whole syndrome of sepsis, then you will start seeing a lot of other things. So there may be we are talking about organ dysfunction. So patient may have an altered mentation. So patients may have episodes where they are irrelevant, or they are extremely drowsy, or they are unable to speak up and tell what actually is going wrong with them. They may have a blood pressure that is extremely low. They may have a saturation, which we have been monitoring because saturation is a word which is now kind of a very common terminology and everybody is aware. So saturations that may be low on air, and they may have a low urine output. So in spite of hydrating themselves well, these patients may not be able to pass enough urine. So these are the commonest symptoms which can be a warning sign for people to suggest that this is maybe a start of a sepsis.
Right. But Dr. some of these symptoms which Dr. Shukla has spoken about are like COVID. When you get COVID, you will have a headache, you'll have a fever, you may be a little disoriented because of your headache, etc. How do I know that it's really alarming? It is not regular COVID, that I need to press the panic button.
Sorry, I didn't really get exactly what you're trying to ask.
I'm asking, is there any specific symptom, what Dr. Shukla is talking about, if somebody's sick in the house, I'm not going to go and ask, did you pass enough urine? I mean, it'll be very tough for me to keep a track of that. Could there be a particular symptom that should alert me that the person is not normal? Because, in COVID, people have high fever, people have headaches, they have extreme amount of fatigue, but it is just COVID, we don't think that it's really as bad as sepsis. Any one particular symptom or something that should really get the alarm bells ringing?
Let's see, as my other colleagues have mentioned already, sepsis is actually a syndrome, right? And a syndrome, the word by its definition means it's a collection of few symptoms or few presentations. So not one single symptom or sign can help tell us that it's a sepsis or so. So it has to be a conundrum. It has to be a combination of few symptoms and signs, as Dr. Shukla mentioned. So yes, no one symptom can help you identify. But yes, if somebody is got a poor mentation, very high temperatures, so it's the organ systems like brain. You get poor mentation, a response to an infection. The temperatures go up. Your kidneys can start producing less urine because they are getting affected. Your blood pressures may drop because your heart is getting affected. So together only we can say that it is sepsis. And yes, they are the symptoms of COVID as well. That is why we cannot outrightly say that COVID-19 is not a viral sepsis, even though traditionally we have learned things in a way. And as Dr. Deepa Dedepia said, that it can be classified as a sepsis according to the definition. So this is a conundrum which will help you identify that we are in sepsis. Next, we need to find out whether it's a viral, which could be COVID, or it could be bacterial, or it could be both.
It could be both as well. I want to understand, Dr. Ansari, are there any biomarkers or any blood work that can tell us that perhaps sepsis is underway? Say a patient has come to you in a condition in the hospital with high fever, dysregulated, you're not seeing good response. Any biomarker that will tell you it's sepsis, whether it is bacterial of a bacterial background or a viral background, but it is sepsis. Is there any biomarker that will tell you?
So thank you, Anisha. I think I'll just go back again what Dr. Mishra was trying to say and Dr. Urvi was saying. And your question, you had a very nice probing question, which probably we can't answer, but I'll try to answer. For this, what is called out of hospital setting, how to identify which patient is a high risk or a red flag patient. It has been shown there is something called quick SOFA, like Dr. Deepak had spoken about SOFA score, sequential organ failure assessment. You have got 6 major organs: brain, blood, heart, kidney, and your breathing, respiration. So instead of going a comprehensive analysis of all the organs, which a doctor would do it once the patient comes to a hospital, but an outsider and any commoner can look at 3 important features. And if we can highlight that, it may probably be helpful for all the audience. One, altered mentation. Any person who is no more talking sense or is not his usual. Sorry, he was fine when he slept night. In the morning, he's talking a little bizarre, not behaving very well. That's first sign. And that is really a red flag. Number 2, any person who is breathing little fast, even at rest, as if he had just climbed a small flight of stairs. And that's very simple. You can feel it. His breathing is visibly, kind of labored. That's called our respiratory rate more than 22. And finally, a person whose blood pressure usually was whatever it was baseline has dropped down by 20% or is not getting recordable, or peripheries are cold. These 3 important red flags are called as quick SOFA. And they can give you nearly 70 to 80% likelihood without any blood test or biomarker, which I'll come to tell that this person has 30, 60 or 100% likelihood of developing into organ failure. So if you have one of these 3 signs, 33% likelihood that this person is going to head for sepsis with multi-organ failure. If you have 2 organs like altered behavior and dropping blood pressure, he's still going to have a 60% likelihood of worsening. And if he has all 3, altered behavior, breathing difficulty, BP not recordable or very low BP, you are in serious trouble. So if you can highlight these 3 parameters, common parameters without any number, that is very essential for people to recognize early on. And coming back to biomarkers, well, there are a plethora of biomarkers, but to name a few, the most important is white blood cell, that is leukocyte count. What exactly is a leukocyte count? But again, they could be in viral sepsis, they can fall rather than rise as in usual sepsis. Number 2 is your C-reactive protein, one of the protein marker which can probably give you an idea of inflammation or infection. Now that's very important. It can rise in even trauma or any non-infectious cause of fever. And thirdly, there is something called procalcitonin, which differentiates most of the time between bacterial and fungal infection. And then there are a lot of them like IL-6, you have got beta-glucan and galactomannan. So these 3 or 4 important biomarkers, when used in conjunction with clinical sign, can differentiate the sepsis syndrome and their severity.
All right. Dr. Dev Prasad, pneumonia is the most common infection that can lead to sepsis. This is what I picked up from the data on the internet. Now, COVID-19 is known to cause pneumonia. So can we say that the risk of sepsis with those COVID-19 patients who go on to develop pneumonia is perhaps higher than those who don't develop pneumonia?
This is for whom?
Yeah, Dr. Dev Prasad.
It's for me. Okay. So you're telling me if a patient who's got COVID-19 pneumonia, is he more likely to be having sepsis? Is that the question?
Yes, compared to somebody who has COVID but does not develop pneumonia.
That's right. So what you're trying to tell is, yes, anybody can be positive for a COVID-19. So if you do RT-PCR, if you have symptoms like a fever, a running nose, you get an RT-PCR done and your RT-PCR is positive. And there could be another way, people who don't have any symptoms, they get an RT-PCR done because some of the family members have symptoms because they are exposed to people who they think are symptomatic or for the purpose of travel. So these people don't have any symptoms and they are RT-PCR positive. So they are asymptomatic RT-PCR positive patients. Others are people who have mild symptoms and who are RT-PCR positive. So in these patients, definitely most of them don't have COVID-19 pneumonia per se. They may have COVID-19 infection, but pneumonia in them. So generally, when you have a COVID-19 pneumonia, so an RT-PCR positive disease, which is caused changes in the lung, generally most of them are either having moderate disease or severe disease. Meaning to say, they are going to moderate disease means they need hospitalization. Severe disease means they need hospitalization and possibly into an ICU. So that is how it is. So most likely, as you say, if you have a COVID-19 infection and they're also having changes of pneumonia on an X-ray or on a CT, most likely they are likely to develop sepsis. Yes, it is okay to say, make that broad statement. Generally, yes,
right.
It is.
Dr. Shukla, would you also draw this? Would you also work this way that if somebody develops pneumonia when they have COVID, they would be more susceptible to sepsis and hence would require more care? Would you also draw this conclusion, Dr. Shukla?
Okay, so if you have
Dr. Desai, the question is for Dr. Shukla. Dr. Shukla, would you also agree that if any COVID patient is showing signs of pneumonia, there is a good chance that he could progress to sepsis?
Yes, so severe disease coming into ICU, needing more interventions, life supports, they are more likely and more susceptible to developing sepsis.
All right. So severe cases need more careful monitoring. So Dr. Ansari, what is the treatment protocol then? Because COVID is a disease where a lot of hit and trial is happening. So, we are learning as we go. But if you're presented with a patient who has COVID-19 and has sepsis, how would you rate them?
So, Anisha, it's revisiting back to what we have learned over the last 1 year. Today, if you ask me, what have you learned over the last 1 year and how has your practice changed? I think it is very clear. Identification and early triaging and initiating good critical care for the sickest one. That is the rock stone on which the foundation of care is built up. So first and the most important thing is identifying who is the serious one, as we discussed before, looking at all the severity markers, the severity of pneumonia per se, and there is something called call score like comorbidities, age, what is your starting LDH, what are your lymphocyte counts. This gives you a peep into the overall immune integrity of the person who comes to you. So if you have multiple comorbidities, diabetic, hypertension, COPD, 75-year-old gentleman whose WBC count is very, very low and the lymphocyte counts are like 400, 500, and the LDH representing the viral burden is very high. Now this is the person whom you need to watch. Because over the first 4 to 5 days, whatever therapy, like you wanted to know what therapy, so the most important tested therapy is whether you should add an antiviral and what is the right time to add a steroid, and is there a disease modifying agent like an immunomodulatory agent like a serine protease inhibitor like ulinastatin or thymosin alpha or something else, whether that can also reduce the burden of inflammation based upon biomarker. So if you ask me to simplify, it's called a triangular approach. You need to have an antiviral, a good antiviral. Again, there is debate which is the best antiviral and how much it helps. But I would certainly use an antiviral in the right time frame. An antiviral, number 2, is a anticoagulant, because they have definitely shown that COVID is a prothrombotic state. And third is an immune modulator. So steroids, if the patient is beyond 5th or 7th day of illness and has oxygenation impairment. And then adding on to any other immunomodulator, depending upon whether he has a propensity to going into cytokine storm or immune dysregulation with IL-6 levels going up, CRP going up, whether you want to add an IL-6 inhibitor or whether you want to manipulate some other arm of immune cascade.
Okay. So, Dr. Mishra, could you give us a timeline on usually when do you see COVID-19 patients progress into sepsis? What could be the way to manage them? If they have been with you all through, or if they've come to you last minute, how could the treatment protocols change?
Well, see, essentially, if we talk about a COVID patient who's come with sepsis or who has developed sepsis while they're with you, which more commonly happens as the disease progresses, as the COVID gets worse, as the timeline moves from 7 days to 10 days, that's when you're more likely to develop a secondary sepsis or your COVID sepsis getting worse, right? Treatment protocol, as Dr. Ansari said, for COVID, the treatment is kind of, what we have learned over a year or so is that you use this triangular approach. You use antivirals, you use steroids or immunomodulators and anticoagulants. And the center of it is a good critical care. But if you develop a secondary bacterial sepsis or a fungal sepsis, then certainly again needs to be treated the way we have been doing it for last 100 years or so. Identify the organism, treat them with an appropriate antibiotic or an appropriate antifungal agents. If the patients require resuscitation or organ system support, what we call as, so let's say if they develop low blood pressure, then we support their blood pressure organ system with fluids and things that can increase your blood pressure. If their kidneys fail, which is part of a good critical care. So yes, treatment is no different as we used to do in the past. We do the same treatment protocol, except that what is important for us to know is that COVID itself is a big killer. It's taking away a huge part of your organ, more so the lung. So you're left with limited resources. So identifying a sepsis early and then working on it earlier and faster is actually the game changer. That's where you change the game.
Right. What are the what is the long-term impact of having sepsis if you have COVID-19? What would you say, Dr. Ansari? Is sepsis associated with long-term organ damage? And will that affect the patient's recovery from COVID itself?
So actually, there is a lot of talk now about what is called as a prolonged or the long COVID. And when we talk about COVID, you can define it on a timeline basis. I would simplify that for our audience that first 1 week to 10 days is actually the viral replication phase, where the virus is multiplying in your body, and that actually determines the quantum of viral burden. And that actually has the most direct bearing on what happens to the next stage and beyond. So if there is something that you can do, like you can use an antiviral or now monoclonal antibody cocktail, where you can reduce the viral multiplication or prevent the virus from entering the host cells, you have the best handle to alter the disease course. Beyond the 7 day or the first week to 10 days, then you move to the next phase, which is the second week or up to 20 days, where you are looking at actually lung involvement, which is actually the phase where your direct pulmonary damage takes place. And that is the time on the 8th, 9th, 10th day that you see a person going into ARDS or breathing difficulty or any kind of respiratory manifestation. And when you do a CT scan at that point of time, you can define whether it is a severe or a mild pneumonia. The CT severity shows how it is. And your gas exchange impairment tells you how badly it is affecting the oxygen carrying capacity. And then comes the third phase, which is a hyperinflammatory phase, which could rightly start from 14 days to up to 3 weeks. And that is the time where you actually define a real cytokine storm. But majority of them are compounded by secondary bacterial sepsis. And if you had already intubated the person in the first 7 days itself or the 10th day, then that can start actually 48 hours after the intervention. So if you had kind of put a person on the ventilator on the 10th day, then this phase of cytokine storm or worsening secondary sepsis can happen very early also. So I would say the third week is the most important time where the infection unfolds. Beyond the 4th or the 5th week, now I am not very sure about the timeline definition, but I think beyond 4 weeks, it can definitely be labeled as long COVID. And majority of the patients who have kind of been followed after COVID have been shown to have very clear-cut. In fact, 17% of the people who have recovered from COVID had one or the other persistent manifestation of either low-grade fever, myalgia, weakness, breathing difficulty, myocarditis, thyroiditis, arthritis, and to name just to name a few. and a lot of PTSD, post-traumatic stress disorder, psychological afflictions. So all of these can come into the ambit of what we call as a long COVID syndrome. Now, whether you say beyond 3 weeks or beyond 4 weeks is empiric, but I think anybody who has recovered from COVID clinically, but still has a set of kind of distressing symptoms, or sometimes even distressing symptoms like fibrosis or need for oxygen, they all will come in prolonged COVID or long COVID syndrome.
Right. But Dr. Mishra, what I've read about sepsis is that, organs are impacted. Your kidneys could be impacted, your liver could be impacted. You've got COVID, and because of the infection, your immune system has reacted and unfortunately affected these organs. So when these organs are affected during the infection, you manage the infection, you control it, and you save the patient. But what is the damage to these organs that were affected by sepsis? Is it long term? Can it be reversed? What is your experience like?
Okay, so basically, as you said, a lot of
I'll come to you. The question is for Dr. Mishra. I'll come to you as well. Dr. Mishra, please go ahead.
Yeah. So basically, what you are trying to ask is what are the long-term organ damages inflicted by? As Ansari said, it could be anything and everything in your body, right? But what are the most common ones? What we very commonly see in our practice? Yes, a persisting lung fibrosis leading to very frequent desaturations, getting short of breath on even the minimal exercise, even a walk to the washroom is actually a long-term complication that happens with a lot of severe COVID patients. So they walk up to the washroom, come back, and they are like, short on breath, and their oxygen saturation drops, their heart rate goes up. So a fibrosis, which takes long time to heal, is one of the major concerning complication of this disease that we have come across. The other that we again very frequently see is myopathy or muscle weakness or generalized weakness. Right? They're all so tired, they're all so weak. उनके हाथ पैर दुखते रहते हैं, right? So this is like again part of the multi-system inflammatory syndrome, which persists for a long time. You do their CRPs and all, you'll find them still a little higher for a long 2-3 months duration, that you'll find them to have a slightly high CRP and myopathies and muscle weaknesses. Some of them have unfortunately, well, these are the two most commonly that we come across, but the list is endless. But some of them have ended up having kidney damages, permanent kidney damages, requiring dialysis for a long time. Some of them have had reversible liver injuries. Their liver enzymes are up for some time. Gastrointestinal long-term complications. People do not have a very good digestive system function post-COVID for quite a few of them. So to name a few, these are the common complications that we come across, and the generalized feeling of unwell, headache, body ache, as I said. So these are the ones that we commonly see.
Right, Dr. Dev Prasad, Dr. Mishra has outlined for us, some of the symptoms of long COVID, and this may be because of, long-term damage to some of the organs. Now, could these kind of symptoms or long-term damage happen to patients who have not got sepsis after getting COVID? Because I know a few of my friends who've had COVID, and they've tested negative for the virus, but they're still complaining of severe fatigue, headache, and they have symptoms of long. This is what is called long COVID. What I'm trying to understand is that long COVID perhaps happens with people who don't have sepsis, but those who have sepsis, how complicated or how worrisome could be the organ damage that they may have suffered?
Okay. Generally speaking, what you're saying is most of them who do not have anything regarding the lung, most of them, even though they have long COVID syndromes, I think on the long term, they generally do well. So what I'm saying is, let's take the case of the brain. So what are the symptoms that you refer to the brain? You do have headaches. Some of them complain of sleeplessness, irritability, restlessness. most of it could just be related to the COVID, and they should settle in a couple of days. However, some of this could be more dangerous as well. Some of these headaches can be because, especially if it's associated with eye redness or pain in the eye, unilateral nasal discharge, bloody discharge from the nose, could be because of a fungal infection that this particular patient has developed because of the COVID or because of the treatment of the COVID per se. So that also has to be kept in mind. Sometimes it is because of the anticoagulant that we have used. Some of these patients are discharged in anticoagulants, and there have been some instances where these patients, because of the anticoagulant, which is basically a blood thinner, it has led to bleeding in the brain. So we call this subdural or extradural hemorrhage. So this is also being there. And very rarely the COVID per se triggers off a clotting mechanism, and that clot, especially in the veins, can cause. So basically what we are trying to say is you could have certain symptoms. Most of the time these symptoms as a part of the COVID are indefinable and they just subside with time. However, if the symptoms persist or if the symptoms are very severe enough, I don't think so you will have to ignore them. You need to go to a doctor who, by taking appropriate history, will try to see that it is not sinister. Meaning that it is not because of a fungal infection, it is not because of any bleeding or a clotting in the brain. So this is what we do. Generally speaking, lung patients who recover generally do well, but there have been instances of patients who've been readmitted to the hospital because of worsening breathlessness, and some of them have we found out that they have ongoing fibrosis, and new therapies that have been antifibrotic therapy sometimes helps to reverse, and some of them just need symptomatic therapy and they get better. But some of them have just gotten to progress to developing severe disease. So lung, it could be a problem. Heart, generally, we've seen patients who had very fast heart beats, which is called racy heart syndrome. Very rarely, the contractility of the heart has also been found to be less, but more often than not, with time, most of this settle. As already said, liver dysfunction, it is very, very reversible. You may have a rise in the bilirubin, rise in the enzymes signifying a liver damage, but with time, most often they settle. Likewise, kidney damage, most often they settle. Likewise, when you talk about platelet count decrease and then they rise. Very, very rarely they have a persistent drop in platelets, which we call as autoimmune thrombocytopenias or immune thrombocytopenias, which would need treatment, but in the vast majority, it usually subsides. So what is persisting in these patients are generally the fatigue has already been pointed out, the long-term muscle weakness, and it has been clearly shown that it is possibly because of the direct inflammation of the infection of the virus into the muscle and the subsequent reaction of the muscle body to it. So that is the cause of this muscle pain, and some of them have the joint pains also sometimes are long-term and need reinstitution of steroids or hydroxychloroquine or other therapies. We call them reactive arthritis. So generally, this is what is a part of long COVID. To say in short, if the lung is not a problem, I think most often the patient should have a reasonable course. Of course, there could be certain sinister causes of headache. There could be sinister causes of drop in platelets. All of them are there, but generally these patients should do well with time.
All right. I would like to thank all our doctors who joined us for this session. You've given us a lot of information about sepsis and a very major complication that could happen in case of COVID-19, what to watch out for, what are the symptoms, what are the treatment protocols, what could be the long-term effects. We want to thank you for joining us and sharing the wealth of your knowledge with all of us. We are grateful to all doctors who are moving heaven and earth to take care of their patients. Here is a small thank you song from our side. Please listen.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया। शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे। सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया। You are the real heroes, आपका शुक्रिया। Thank you.
For joining us this afternoon and sharing with us the wealth of your knowledge on the topic of sepsis and how critical it can be for COVID-19 patients should they progress to the cytokine storm and the cytokine storm progress to sepsis. Thank you all for joining us. This session was supported by Uric Pharma, and we are very grateful to Uric Pharma for their support in creating this awareness. A big thank you to all the doctors who joined us. And now I would like to hand over to Kamal Narayan, who is with us to take us to the next session. Kamal?
Thank you very much, Anisha.
Thank you so much, Anisha, and thank you so much all the doctors for joining us on this session. It was a wonderful information shared by all of you. Thank you so much, and thank you so much for all your work which you are doing serving the humanity. So now we will be moving on to the next session, and this session is a special session with COVID Samaritans. But before that, I would request my team to play a video of the glimpses of COVID Gratitude Week, the 5 days of Gratitude Week which we are having so far, a glimpse of the same.
History shall bear witness that when the time came and humanity needed to be saved, it was the doctors who stepped up to answer the call of duty.
WHO के द्वारा जो ये आपने डॉक्टर्स डे पर, चिकित्सा दिवस पर इस कार्यक्रम का आयोजन किया है, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ।
Congratulating the Integrated Health and Wellbeing Council for this unique gesture to honor the doctors and other people in the medical community who are the most dependable resources to fight this pandemic.
7 दिनों में भाग लिया है, तो सभी का मैं धन्यवाद करता हूँ। डॉक्टर डे के अवसर पर दुनिया के सभी डॉक्टर को, भारत के सभी डॉक्टर को मैं शुभकामना देता हूँ, हार्दिक बधाई देता हूँ। जय भीम, जय भारत।
I would really say the doctors have actually risen to this challenge in these unprecedented times, and that is something which is very heartening, not only in our country but at a global level.
We got to get together to support a true legislation and a strict legislation of against assault to doctors.
We need to be really serious about and have a rethink about the final delivery system we need to adopt about the delivery of healthcare. Should it be state versus the central?
By communication, having compassion, having empathy, feel the pain of the other person.
Having said that, have 3 attributes: sympathy, empathy, and compassion.
There is a lack of empathy. Probably that is one thing I can agree with that, but there are other issues that many a times the doctor is helpless.
Younger population is definitely, active. That is why they are more, exposed to infection, and we cannot say that they are less or they are going to be in future.
So definitely there has been an improvement in the number of stroke patients coming to the hospital, but it has not still reached the pre-COVID level numbers.
What COVID did to especially India, one, it disrupted the NCD services totally. The second most important thing it has caused.
We need to talk to actual people in the Center for Disease Control, the virologists, people like you who are on ground. We need to understand and fight this scientifically.
Yes, the fear is still there, but as I said that the passion is to hear one day that India is a developed nation.
खूब लगा लो पहरे रास्ते रब खोले
तू न जाने आस पास है खुदा
Thank you so much for the team for playing this beautiful video of the glimpse of last 4 days of Gratitude Week. Now, let me begin this session. So good afternoon, everyone. I welcome you back to a session of this Gratitude Week, which is my favorite one. In this session, we get an opportunity to interact and appreciate the work of COVID Samaritans who voluntarily took up the responsibility of helping those less privileged or hit hard by the pandemic. While those in white coats that were replaced by PPE kits were struggling to save each patient who was rolled in their wards, many others ensured that people do not lose their life or limbs, even if the much needed healthcare was sparse. They were arranging anything and everything people needed to make them clinch to life, from food to oxygen, from arranging a hospital bed to a dignified funeral. These Samaritans were available for everyone, everywhere, at the frailest of the call. And I'm just amazed to see there were so many of them working at many levels. And once a few such personalities who are joining us today have done wonderful work of reaching out to the people at a time of this crisis. And we are privileged to have three of them joining for this session today. So let me begin by welcoming the most eminent and who needs no introduction, Mr. Sohail Seth, a businessman, columnist, key speaker, and a TV pundit. Mr. Seth is known for his flamboyant charisma, deep insight of Indian business, political and social milieu, and an incredible sense of humor. We also welcome Danis Manjoor, editorial director of Asia News Week. Mr. Manjoor is the youngest ever to hold this position of editorial director at the International Business Times, and he has served as the youngest resident editor of the India's leading tabloid Midday. He is an IIM Ahmedabad alumnus with diverse leadership experience ranging from print, broadcast, digital journalism, management and civic tech, media tech, and many others. And last but not the least, Savita Chanda. She is a consultant for executive search and advisory and also works with an NGO called India Cares Foundation. So first of all, let me put on record our deepest gratitude to all of you from the ISW Council and its community of health champions, health enthusiasts, and health promoters. And let me go to Mr. Sohail Seth first. Mr. Seth, everyone has kind of you have your own fan following. You are one of the, I think, a face which is familiar to maybe almost entire urban India. And when this pandemic struck and the people were kind of stranded, you utilize that fan following, that the community which follows you, for amplifying these informations, these SOS calls. How did it start? Was it, some specific calls started directly coming to you personally, or what made you to actually leverage this clout which you hold for the benefit of maybe so many people?
Thank you for having me, and thank you and welcome to Danish and Sabita. I don't think we have any clout. The only man who has clout in this country is Narendra Modi, and he hit during the second wave. So I have zero clout. I don't have a fan following. I have a community of followers on Twitter, on other social media. And Kamal, this is not the first time that I have used social media to amplify issues qua health. And I'll tell you why. Health has been the most neglected category in India other than education, which is so sad because these are the pillars of any society. When I first joined Twitter, I started getting requests for blood. And what shocked me was not the fact that people were asking for blood, but the entire geography of India was blood starved, in the sense that the blood banks were in ruin. People were being asked to pay exorbitant amounts of money for blood that they needed for their loved ones, which to my mind was ridiculous. The government was absent. You've shown a video with Harshvardhan and all these people. These people, and I can say this bluntly because I'm not wedded to any of these jokers, they let the country down. And they let the country down terribly. To now say that, oh, abhi sab kuch theek ho gaya and all, what actually the pandemic did was it showed how, whether the government cares for you or not, whether the state chief ministers care for you or not, an Indian will care for a fellow Indian. No matter how much you divide people, no matter how much of hatred you spew, no matter what kind of caste, creed, religious divides you create, ultimately Indians will fall back for Indians. And that was the revelation of this pandemic. When this pandemic began, this was in March 2020, you started having initial calls of help. The help was of a very basic kind. People whose parents are overseas, the children, parents whose parents are in India and the children are overseas, they didn't know how to, help their parents who did not have domestic help or did not have people to look after them. That's how it all began. Because we remember the lockdown was very severe. The whole Janata curfew and the lockdown, it was a severe time. This person, whoever, Deva Prasad, to, mute himself.
Yeah.
Okay. So you had a pandemic situation where people started by saying, look, my parents are living in Jalandhar or living in Bulandshahr or living in Malda. Can someone please help? What was remarkable, Kamal, was no one asked what is their surname, what is their religion, where do they live, what do they do, but they needed help and help was given. That, to my mind, is a salute to every Indian and a salute to IHW for even having this week of gratitude. You don't need to thank Danish or Sabita or me. You need to actually have an India Gratitude Week which says India Gratitude Week for every Indian. Whether they helped or not is irrelevant. There are lots of people, Kamal, who can't help, who were starving, both for medical attention as well as for food. There were people who may have wanted to help but couldn't. Then we invented the cursed phrase, migrant workers. When Sunil Mittal moved from Ludhiana to Delhi, did you call him a migrant industrialist? You did. When the Munjals moved from Ludhiana to Delhi, did you say migrant? No. But you tarnished workers, people who gave up their lives to work in urban centers because rural India was starved of employment. You started tarnishing them by saying migrant workers. That, to my mind, was a defining moment in India's history of how we treat our people. Then came the actual pandemic, in the sense when we saw the full flow. And the full flow in the initial times was not that bad. It was bad, but it was primarily, isolated within large boroughs of urban India. And people were asking for basic things, primary among them being information. Then again, we had our troika of absolute dolts who were managing the process. People like VK Paul and all. Every day a new statement was being made by these jokers. Then you had some minister who would say some stupid thing, do this. You had Ramdas Athwale on your video. He was the man who stood with the Chinese consul general in Bombay and said, go Corona, go. These are the duffers that we have in the union cabinet. So you had to create amplification which was devoid of these people, because real people were concerned with real issues. When the second wave hit, two things began to happen. One is there was a rush for hospital beds, any bed. And there wasn't a rush for hospital beds only with ventilators or for oxygen. There was a rush for hospital beds. Then came the oxygen crisis. And linked to that, which is shocking, I'm getting goosebumps as I speak to you, was people saying, do you know people at any cremation ground? That told me about how we have come and how far we have degenerated as a society. It's all right to talk about GDP and 5 trillion by 2025. Those are platitudinal things. So what did one do? One did nothing extraordinary. So I'm not even worthy of being on this panel. You've been kind enough to invite me. I can only share that it was not me. It was millions like me who used their social media handles to amplify. We were only adding our weight to that mill, to the manthan from which we could get nectar rather than keep the churning of poison. We were only adding succor. We were adding weight. We were adding empathy. But most importantly, we were adding concern. See, when a person is unwell, he may want your medicines, but more importantly, he wants your concern. He or she wants your empathy. And I think what social media did was, it showed you two things. Number one, how every Indian is actually not a Hindu or a Muslim or a Sikh or a Christian. Every Indian is actually an Indian. Number two, what it taught these people in every political party. See, all of them are rascals. So if you think BJP is bad, all are rascals, all self-serving people, most of them at least. What it showed me was that political parties are there for power, but you have to power the belief in every citizen.
Thank you so much.
I believe that was the defining moment.
Yeah,
I hope I don't get your counsel into trouble, but if I do, that's par for the course.
So, Mr. Seth, I may agree with some of your points.
No, I'm not looking for agreement.
Agree with some of your point, but what is more important here is that you did something very remarkable. Whatever way you could do, by adding weight to some of those frantic SOS calls, by using your, if I can still consider the word cloud, for pushing and making those unheard voices to be heard, or maybe to become more visible. And that is, from our council's point of view, is the most important aspect which we want to highlight. Because this Gratitude Week is not only for doctors. We started from a Doctors' Day because that's a very kind of relevant occasion to begin this kind of observance. But it is for all those health workers at any level. Somebody who is working in just simple pharmacy, ensuring that the medicine is delivered at your home, despite the lockdowns, and also not only lockdowns, at a time when the fear of life was or death was everyone's mind was clouded with that. And at that time, putting the fear back and then going on the work, it makes all that, the difference. So thank you so much for your whatever work, you did. It was wonderful. Let me just, invite our other two people, and I'll be coming back for a couple of more remarks from you. Danis Manjoor. So, Danis, I have been seeing a lot of work happening from your side, and while Mr. Seth did a lot of work in terms of amplifying the messaging, we could see that you were also doing a lot of work on the ground, ensuring that the people get admission on the hospitals, doctors get, people get doctors consultation, or maybe oxygen supply or something like this. What all happened? Could you relive, some of those days? They were definitely very, 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 kind of difficult for everyone, but they can definitely give a lot of inspirations for others to, kind of come out for
Right.
to serve humanity when there is a need for it to be done.
Right. Thank you, Kamal, and thanks to all of you. I think it's more than just anyone's individual contributions, whatever we did during this pandemic. This was absolutely unprecedented, as we are all aware. None of us was actually prepared for it, neither the government nor the people. And when it hit, thankfully, one good thing we saw was the entire nation coming together as one, as Suhail also mentioned earlier. When the nation came together as one, it was extremely heartening in this absolutely distressing situation, which appeared to be something straight out of a dystopian movie, because none of us had ever thought that we would be scrambling for oxygen, we would be scrambling for hospital beds, despite the fact our health infrastructure from the past, since inception, has been absolutely horrendously managed. And then when this pandemic hit, we realized how bad it was. Now, come to think of it, would any government have been able to handle this better? The answer is yes. But would any government would have been able to do something more than they did? The answer is yes. But then look at it this way. Even if an average cases per day would have been around 20,000, let's take it in any metropolitan city. Out of those 20,000 cases, even if 1% were to be severe, which required ICUs, you would require a minimum of 1,000 ICUs per day, 1,000 ICU beds per day. How on earth, in a country of 1.35 billion, would you ensure in a metropolitan city 1,000 every day and very minimal discharges happening as well? So, as I said, governments did falter. Definitely, they did. The health infrastructure, which is clearly missing, it did. But one thing what emerged out of it was the human element. The humanity was the one which sort of emerged as the winner out of all of this. We saw people of all color, caste, creed coming together, like Suhail also mentioned earlier, and I keep mentioning this, that was one time in my entire life on Twitter that I actually felt that it isn't as bad as we think it is. India is still the beautiful, wonderful one nation that it is, and people by and large deep down still believe in this country. So when we used to get these requests, it started from one hospital owner raising an SOS and telling me, I've got just 2 hours of oxygen left, what do I do? I was clueless, because they were IAS officers, IPS officers, they were ministers who did not and could not find beds for their loved ones. What do we do? So we realized we have to go dig deeper. We have to do something about it, and not just amplify, but see an end-to-end execution. Instead of helping 20,000 people, let us help 200, but see end-to-end, that these people are admitted to the hospital, treatment is guaranteed to them, and then after discharge, we also help them with post-COVID care as well. So from that one hospital, the scramble began in Karnataka. At how do we get the hospital oxygen? So there were so many procedural issues. We also saw the worst kind of human side as well in this, right? There was a deal that there was an oxygen supplier who refused to supply oxygen to a Bengaluru hospital just because in the non-pandemic phase, that hospital owner used to purchase his oxygen supplies from somebody in Kerala or somebody in Chennai, and the Bengaluru one, since it was more expensive, he said, okay, they did not take it from me then, I will not give it to them now, right? So it's just revolting, a thought that you would withhold oxygen in such levels. So we pushed the government and they were able to get oxygen in time, and that's when it started. I think the most important thing and the learning from this is, Kamal, that we failed, apart from failing in terms of ensuring quality infrastructure, or even the basic health infrastructure. We also failed in our communication modules with respect to COVID. A lot of people would not have required ICUs in the first place had we trained them, had we sensitized them well on how to use oximeters, something as basic as that, and also when to go to the hospital and what to do, who to call. So most of the people in various regions, what we saw is they would wait for their oxygen levels to dip till 80, 85. And by the time they scramble for hospitals, the patient gets so worse that the patient's SpO2 levels drop down to 60 or 50, which means the patient requires an ICU or an ICU ventilator. And God knows we didn't have them, right? And we lost a lot of patients due to that. If only we had educated the public better at panchayat level, at the village level, at the halka level, if we would have ensured to educate people on how to use these oximeters and how vital these are. And that's why, by the way, I started this free oxygen delivery, oximeter delivery service in Bengaluru as a pilot project, because and keep it in motion, because we possibly can't have enough oximeters in India. In a country of 1.35 plus billion people, we'll never have enough oximeters. So we said, okay, let us give out these oximeters and trust the people that they will keep it in circulation. And trust me, the public did not break my trust. They did not. I was told by people that you should have some security deposit. I said, no, let's not make money as a barrier for people to have access to oximeters.
So essential, yeah.
Right. So when money was not the barrier, people used it and people kept these oximeters in circulation.
Thank you so much, Danish. And I think that's where Mr. Seth was also saying that the gratitude should be for the all Indians who all stood somewhere for somebody, and this is where the humanity has to come and play a role into this. Let me also go to now Sabita. Hi, Sabita Chanda. We have been seeing a lot of my team told a lot of work happening from your end also on the social media platforms. What all was coming to you, and how did you help?
Hi Kamal, thank you so much for having me here, and to Daniel also and Suhail. Pleasure being here along with you all. Like when Suhail sir was talking about the last 1 year, I almost choked because the experience, it was all over, experiencing and thinking about the past 1 year all over again. I remember April 2020, I think it was 16th, 17th April, when one fine day, I think it was Arun Bothra sir, IPS in Odisha, who formed this group, India Cares, and a group formed out of nowhere, like on social media, on Twitter, to connect all the volunteers across the country to come together, irrespective of, like Suhail sir said, irrespective of caste, creed, religion. And overnight, there were volunteers across the country who came together, connected on social media, and adapted to all the requirements since the last 1 year. It started with the migrant workers. We had no data, no nothing. Overnight, there were 2 IT people who, Pulkit, Naman, they formed a Telegram group, connected all the volunteers across. And it was migrant workers to start with, how to help them reach their home from South India to different parts of the country, connecting with various NGO groups who were supporting at that time with their travel, with helping them travel back home. Once that migrant crisis took a little, was almost over, you can't say over, but it was sorted somehow. Then online education, ration request. This was about the first wave that I'm talking about. And the team, irrespective of whichever state they were, we all connected with various groups, South, East, North, West, and tried to bridge the gap between who needed help and who could help. Then slowly and steadily, the second wave started. When the second wave started, there was this, like Suhail sir said, blood requirements during COVID time was very, very tough. There were people who would not go to the hospitals to even donate. How to even donate blood. Plasma, at that time in first wave, I think plasma, there was not too much of a request, but there was, in the initial beginning, plasma request had started coming in. So it was a major crisis at that time. So after all this step by step, plasma request, it was like, I think December, January, February, in different parts of the country, wherever the crisis for plasma was happening, we tried to bridge the gap, got in touch with the hospitals and got in touch with various volunteers and helped out people in plasma crisis, during the plasma crisis situation. And then suddenly the second wave happened, oxygen crisis, concentrator crisis, hospital crisis. I remember one instance where it was at night, 2 o'clock, I got a call from one of the hospital in Delhi that we have almost run out of oxygen and we have just half an hour time for the oxygen supply. Not knowing anything, I remember that 2 a.m. call to Arun Bothra, sir, there's a crisis. This hospital is saying they don't have oxygen and only for half an hour. I think it was at 3:30 or 4 o'clock, I got a message from her that it was sorted. Arun sir at night, like there were times then volunteers and even sir would not be sleeping at night till 4, 5 o'clock, everywhere, like irrespective of who, from which state, who was doing. And the best part, Kamal, is we did not see what the government is doing or government is capable of doing or not. We just connected online over Telegram, requests coming in Twitter and some from offline. Then they would filter it to the Telegram and people would just pick up all those requests. Okay, there's a Russian request or there's migrant, 10 people, 50 people wanting to go home. They would connect with the local administration, connect with the local NGO groups and connect and schedule how they would reach. And it would be like overnight. There have been times where 2, 3 a.m., 4 a.m. in the morning. And then suddenly there would be like there are people traveling, there's no food. And then connecting with the railways, group was formed where we were in touch with the railway people, a few of the members. They would connect and it was like 24/7 volunteers walking across the country. I stand today here on behalf and of all those collective volunteers of not only India Cares, but SOS Saviors, Coast Group, Migrant Travels, all these people who have made things easier, connecting everywhere, bridging the gap wherever they found it missing. And then, and with all the doctors and hospitals also, like all this, and it was not only the volunteers, along with, like when we say that the administration is not working, we try to bridge that gap also, connecting with the district administration, connecting with them and making it simpler that, you know, and for every small little thing, be it blood, be it ration, be it like after reaching home, there have been cases where there was a cyclone also in Odisha, houses, you know, helping them in terms of repairing of their houses. For all kinds, we have just adapted to all the requirements or the changes which happened from first wave to second wave, be it the migrant travel, ration, online helping, laptops, mobile phones, blood, oxygen. So we have been doing that all with different volunteers specialized in different category companies.
Thank you so much, Savita, for kind of sharing all that. And most important, again, what I see is that all these people who are working, they did not care that whether the government is working or not working, whether this should be done by the government, whether it should be done by a state government or by a central government. I did hear some of those stories, people reaching out to some officials or maybe sometime some people with important portfolios, and they being turned down by saying that it is a state matter or it is a central matter, something like this. So at least the people of India took this responsibility that it is their matter, it is not anyone else's matter. Mr. Seth, I saw one of your recent video, I think that is what on the Doctor's Day, and we did discuss that aspect also, that why when we are seeing that these doctors are kind of toiling hard, putting their, our life on priority, leaving their families, young ones, loved ones at home and working for us, is still, and we were expecting that, with this all positivity around this, doctors being termed as Corona warriors, as somebody, working like a soldier. And then again, after some time of, first wave, the whole cases of violence against doctors, all these things start coming back. We did see some of those, issues related to, which came out of fear, driving or asking doctors to leave their rented accommodations and all that, which happened in Delhi. Some of the places in South India, we saw even that, a burial place was denied for a doctor. That was, let's say, the fear of, the first wave. Maybe out of that, some of that happened. But even in the second wave, and post that also, so much of violence cases were registered or, reported, which even led to IMA asking for a countrywide strike, not as a, going out of the work, but at the same time, registering their protest. How do you see that? And what do you feel? Is there a need of more laws? We already have an ordinance, or it is just that we as a human being need to change and
see, how many laws will you have?
Yeah.
By and large, we are a country which is populated by emotion rather than by logic, largely. There are idiots all over the world. You think there is no violence in America against doctors, or there's violence in schools in America? Law se kuch nahi hoga. If you want to change society through education, rather than worry about which Hindu figure or which Muslim god or which Hindu god or which Christian god they should mention in history books. Teach children civics. Teach them moral science. Parenting is absent. माँ हमारे देश में गायब है. माँ हर घर में होती है, पर जो माँ पहले थी वो आज की माँ नहीं है. And let me tell you, माँ जब गायब हो जाए तो संसार और समाज दोनों ही are at peril. They are in danger. So what laws will you bring? The damage will be done. You think the people, and please don't say it's the poor. I have seen more rich people behave badly than the poor, because the rich feel they are entitled to behave badly. Politicians will walk in as if they own the goddamn country. Which politician will you arrest? Kiski himmat hai? There are politicians who are beating up district magistrates. They're beating up superintendents of police. You think they'll care about beating up a doctor? They'll beat up a doctor. You need recalibration of society. That's a long haul. Number two, as you rightly said, post this pandemic, and it's sad that it took a pandemic for us to realize, and that's why I did the video, that people who save lives are also capable of losing them. See, a doctor doesn't lose a life because he or she wants to. Why the hell do you then blame it on God? जब आदमी बच जाता है, you don't thank the doctor, भगवान ने बचा दिया. आदमी मर जाता है, आप डॉक्टर को ब्लेम करते हो, क्यों भाई? तब भी आप भगवान को ब्लेम करिए. एक्सीडेंट में अगर आप मर जाएं, you will blame the truck driver. आप बच जाएं, you will thank God. Why will you not thank the doctors who have saved you? It's our upbringing is a bit chiseled. So I think we need recalibration of the way we are brought up, and parenting in India is missing. There is a sense of entitlement. Law se kuch nahi hoga. It's about breeding, it's about upbringing, it's about value systems. On that note, Kamalji, I'll have to leave because I have a flight to take.
Thank you so much for your time.
Thank you, Danish. Thank you, Sabita. Lovely to virtually meet you, and God bless and stay safe. Thank you, Kamalji.
Thank you so much, sir. Thank you so much. And keep doing good work, whatever way you can help the society. Thank you so much.
And if you get into trouble, you can always blame me. Thank you.
Thank you. So, yeah, Danish. Danish, let me, ask you that when you tried to start, putting those help together and reaching out to the people, you mentioned about oxygen. Actually, we also saw many doctors, kind of trying to go here and there, try to find out how they can manage the oxygen for their hospital. Small hospitals, were kind of scrambling to get oxygen. How many such hospitals you could, provide STD support, or can, at least convince them that, okay, you focus on the treatment and we will put our resources. However, let me tell you, this was not supposed to be done by individuals. It is to be done by the system, by the administration, by the government. But still, you people. So how did you ensure that this steady supply continues so that doctors or hospitals can take care more of their core work rather than running for these basic essentials?
Right, Kamal. So I think the problems were multifold and on multiple levels. In terms of hospitals, we were able to help around 4 hospitals in the immediate vicinity in ensuring that their oxygen reaches on time. And there was no magic wand for this, let me tell you this. The only thing you needed to do is to ensure that you push the right officials at the right time to do the right thing. And that's the unfortunate thing, right? That we had to push the right officials to do it. We had to, thankfully, there were some really wonderful officers as well who sort of rose to the occasion, and then they went out of their way to help these hospitals out and help public out in this pandemic. But by and large, again, I'll come back to the core of the problem. Hospitals will require extra oxygen only when that load of patient load would increase to that extent, right? So the idea was itself to ensure or try to ensure that we reduce the patient load, right, that which goes to the hospital. So that is why the focus was on doing a lot of teletriage. So a mission which I, from my end, started as an individual. Eventually, I had 5 of my wonderful volunteers joining in, and day and night, 24/7. It was the month of Ramadan. I was fasting during the day, and then I remember we used to get a few hours of shut eye. And then when we wake up, we see these SOS messages that somebody had passed away. You would just feel so guilty that why would you go to sleep? If you were up, would you have been able to save these lives, right? We had our volunteers, so many of, not just my volunteers, but even all the other volunteers out there, many of them underwent extreme depression, extreme anxiety because of this, right? So we had to also look at their mental health. So teletriage became the focus for us, that, okay, let us get in touch with people who have been tested positive. Let us prepare them for what is to come and when they should act and how they should act. Because when we educate these people on how to act, they would know exactly when to contact the hospital, when to reach, and how to book the bed. The problem was that only very few people know how this bed booking systems operate and how to get this bed done, and which ultimately basically put a lot of pressure on a select groups or select individuals. So we said, no, let us democratize this. Let us teach people how to do this so that they get to do this on their own. And hence we had a huge network of volunteers and individuals who jumped in eventually, various aspects. Some help in bed booking, some help in finding the oxygen, some help with finding oximeters, some help with finding the regulators which come for oxygen cylinders, some were deputed for oxygen concentrators, some were there to ensure, unfortunately, death certificates, and then of course the dignified burial, the dignified send off to people, right? So everybody, the entire nation came together as one and worked as a system as a whole, which was absolutely wonderful. But on that note, it is extremely important that all of us do not let our guard down. Whether the third wave comes or not, we really have to ensure COVID SOPs are followed, because we have seen what this pandemic can do. If we still do not learn, I have no words for any of us then, really.
Yeah, thank you so much. Very important message, Danish, that it is not the time to let our guards down, because, and I think that is one of the contributor of why we were late to actually, we got pushed into second wave, and stopping ourselves from getting into the third wave is in our hand, and everyone has to behave that way. Sabita, let me just ask you. We saw many such issues going around, and all that which you have listed or Danis has listed. But share some. Would you like to share some story where you might have really? Danis mentioned about that. Even if you lose one life and then you come back and see that, okay, there's a feeling, and then which kind of that develops in you, that when you are putting so much of effort and you are trying to help somebody. I did lose some of my friends also, and we were trying one day get a bed, or other day remdesivir or something else, and the fourth day you hear that he's no more, or he's no more. Some stories where you actually saved lives and you felt so happy, or could when you were able to reach or provide something essential at a time when it was so important, which actually kind of gave you enough impetus to keep moving what you were doing?
Kamal, every single day, the last 1 year, along with the volunteers across the country, we have cried together, we have laughed, we have smiled together. There were times that we would cry at 2 a.m. in the morning, the laugh the next day over hearing stories that the patient's, health has improved. Like when I talk about India Cares and my role there, right from migrant travels also, there was one particular division of helping with plasma that I was taking care of. And believe me, like when Suhail sir said that we have to make people aware, getting people to donate plasma or blood required tremendous effort during the COVID time, where it required almost 40 minutes of counseling donors as to basic questions which they were not aware of after being treated from COVID. When they came back, to ask them or to convince them even to go and donate plasma was a huge task. And the volunteers would spend hours, half an hour, 1 hour convincing them, saying that one plasma of yours can save 2 people's lives. And when that person went, initially they had hiccup of going to the hospital or blood bank to donate plasma. But after reaching there, they say, no, thank you, ma'am, for convincing us to donate plasma. And when after donation, after a month or so, they will check if the plasma whom they have donated, if that person, how is the health, and did I make a difference or make a change? I remember one particular incident. This was in Bombay. There was a daughter who could not find a blood plasma for her father. It was a rare blood group. And she cried the entire night, ma'am, you have to save my father. I remember there was no blood plasma available in entire Mumbai, no blood banks. But somehow all tried, all our connect, all blood banks and everywhere. And finally, on a Sunday evening, we managed that blood plasma from Nasik. There was a group from Nasik who said, no, we are sending the blood plasma to Bombay. The brother and sister, the father was critical, and they sent it from Nasik. And in Bombay evening, when I gave them the news that blood plasma would be there by 10, 11, you can collect the blood plasma from XYZ blood bank. And today, her father is hale and hearty back home. And every single day from that day now on, every single day I receive a good morning message from her. Thank you for saving my father's life. Like I was just a connector, but thank you, because that kind of small little moments like happiness. Every morning, Kamal, I would receive messages, somehow good messages, sad messages, someone sending message that I've lost my father, I've lost my mother, I've lost my brother. And along with that, again, help request. So we never had the time to actually sit down and actually like cry. Again, we had to gather our energy and get back into the request. Similarly, there was a case in South, I remember, from Tirupur to Jharkhand. There were almost 12 migrant workers. One of our volunteers was in touch with them. They were bonded laborers, and they were beaten up by their employers, saying that you are not going to go back to your state. I remember how we got the administration connected with the social worker groups and helped them through the administration group and made them reach back home. Until these people are still in touch with our volunteer. I want to take this opportunity to thank all the volunteers across the country who have not met each other. Like probably 99.99% of the people in India Cares have also not met each other. But over the last 1.5 years, I can't tell you how we all have work together, and for any crisis situation, from first wave or second wave, they have connected irrespective of which place, what religion, or if administration is working on. Each one in their own state tried connecting with the administration, connecting with the social group and connecting with the officers. When we say officers don't work, administration don't work, here I would like to say that we have tried our best to bridge that gap also. There have been places where we have connected for even for small little, for blood also we have connected with the administration. For everything, all volunteers across the country have connected and made things easier, I believe, during this crisis time.
Thank you so much, Savita. And I can understand when you are, saying that the mobile phones were, coming up with so many of those positive, negative, good, bad news, and and the good part is that at least you people were also getting those good news where you had helped somebody. Somebody has got that help. I used to fret every morning before picking up the phone because it was largely a bad news, because you were not able to help many people, and you end up not being able to help, and the requirements which were coming was almost not there, but you people actually tried to kind of move a mountain almost to ensure that things reach, and they reach from any part of the country, as you are mentioning about that plasma getting arranged from Nasik for a patient in Mumbai. So thank you so much both Danish and Savita for your wonderful work which you did, and it definitely encourages us. And as part of this gratitude week, we we place our sincere, heartfelt thanks and appreciation for your work which you did. You voluntarily came out for the sake of society, and that's what makes the whole humanity so beautiful. Thank you so much. We would be placing just a token of appreciation from ISW Council as for your work as a COVID Samaritan. Thank you so much for that, Danis. Your even Twitter handle says a lot. Tell DM. So you are encouraging people to, if you need something or if you are need of a help, just tell Danis Manjur. That's wonderful, gesture and wonderful work which you did. And Savita Chanda, keep doing that great work. You people are like those harbinger of hope for the whole society, and we are so thankful for your work which you did. Thank you so much.
Thank you so much, Kamal. Thank you.
So here there are three COVID Samaritans, Sohail Seth, Danis Manjur, Savita Chanda, who did fabulous work, who actually rose up to the occasion, did all that needed. And with this, we are ending the fifth day of the Gratitude Week. We will be back tomorrow at 11 o'clock with the new set of COVID warriors, health heroes, and many those leaders who were doing what was needed at the time of COVID-19, and also for the sake of to protect, to ensure that we are staying at best of our health. Thank you so much.